Welcome to Social Quiztancing, everyone. I hope all the participants have joined in by yet. I guess yes. Welcome to Social Quiztancing. This is me, Garima Dugar. This is our first edition of Doctors for a Cause's medical quiz. I welcome all the finalists today. Doctors for a Cause is a non-profit, non-governmental organization working towards the welfare of the society in general. We are a body of medical students, interns, and young doctors based primarily out of Kolkata. So I'll just tell you more about this initiative called Social Distancing. It is mainly was brought about by the idea of keeping all the people entertained, yet collecting the registration money for helping us sponsor an underprivileged children's education. So thank you to the all the participants who took part and helped us in this initiatives. The prelims was yes very difficult and it was very close neck to neck competition. We have got a finalist. So I'll just tell you our finalists for today are. So we have 6 teams for our finals. Team A, that is Simran Jain and Prithvi Basu Roy. Team B, Archan Bhaumik and Prithvish Sanigrahi. Team C, Utsaha Bhattacharya and Soumya Bera. Team D, Upmanyu Nath and Sujaya Chattopadhyay. Team E, Narayana Murthy Ganesh and Anirudh AS. Team F, Rimjim Kumar and Alisha Chirai. Welcome to our finals. So we are also live on our YouTube. So I think all of your friends must be watching in. For our YouTube live audience, thank you for joining in. I hope you guys are entertained by this initiative. I would like this opportunity to tell you 2 more things about Doctors for a Cause. One is we are having 8 different task forces working towards different causes, yet another under the same roof towards the same goal. So if any of you wish to join any of the task forces, do contact us and let us know. So we've recently have grown this big that we've come this far, crossing the 12K mark. This was a 1 month back when we crossed the 10K mark on Facebook. Now we are 12K plus fan following and a student base and a base of 12K on Facebook. So we were just small as a group of friends who started an initiative in college, and now we are a big body of medical students and interns all over the country. This was one of the first initiatives that we had, and these are some of the initiatives that we have done for the past 2 years. This was the menstrual hygiene camp where we had donated 2,000 sanitary napkins to a NGO. Team Soch, one of our first street plays about HIV and awareness. Uh, so yeah, these are the some projects that have been done by us over the years. I think all of you all already know how bad West Bengal and the this area was hit by Amphan. So thank you to all the people who donated for the cause of Amphan Relief Drive and helped us reach out to the people who got affected by this. So like all of you all already know, educational team has been working really hard, and we have a couple of webinars already up on our YouTube channel, from radiology to neurology. We have it all in the masterclass format. So if any of you wish to go back and have a look, it's all there. Do share and subscribe and hit the bell icon if you wish to keep updated if we put up any new video. I would take this opportunity to thank our sponsors for this event, PLA Remedies, Dr. Bhatia E. Gurukul, and Kasen Pharma and Athulya Assisted Living, without whom this event wouldn't have been possible. These were the people who helped us get the prize money for the winners and also helped us with our initiative for the donation part. Thank you so much to the sponsors. So, thank you, everyone. I'll just take another minute before we start proceeding for the finals. So we have a guest of honor today live with us, Dr. Tithankar Guha Thakurta, who is an MD Physiology and a teaching faculty at KPC Medical College and Hospital. I don't think this event would have been possible and without his guidance and support. He's been an eminent part of this team. We welcome you, sir. Sir, would you like to say a few words to our finalists and address this occasion?
Yeah, hello, Garima. I'll not take much time. I'll
Yes,
just say
sir.
all of you are doing a wonderful job. It's very difficult to keep people entertained in these trying times. And then channelizing this energy of entertainment into something more productive. That's something wonderful that you are doing. I really enjoyed the prelims, and I hope that the finals will be as interesting. And I express my best wishes to all the participants. Doesn't matter who wins or who loses, but all of you should take part avidly and enjoy the session. Thank you.
Thank you so much, sir. I guess you guys are motivated enough and excited to go ahead in the finals. I wish all the participants all the best. May the best one win. Uh, Happy quizzing with us, and do let us know how you felt and how you liked our event. I would like Giri and Venkatesh to take over and go ahead with proceed with the quiz. Giri, I'll just address them. Giri is one of our board members of Doctors for a Cause. He's third year student from SRMC. So, Giri, can you just take over?
Yeah, sure, Garima. Just give me a second. Just give me a
Yes,
second.
Giri.
Yeah. Garima, I hope I'm audible and clear to everyone.
Yes, Giri, you are.
Okay, fantastic. Okay, so guys, thank you, Garima, for that introduction. So I take this opportunity to welcome you all to the first edition of the DFC Medical Quiz. We've called it Social Quiztancing. This time we will have a different name next time, definitely. Hopefully, we are not social distancing by then. So yeah, we'll be having a different name, definitely. Without further ado, let me just jump straight into the finals. So just give me a second to share my screen. And yeah, okay. So after, I think we had close to, I think 66 teams, if I'm not wrong, in the prelims, and I think it was a really close fight for the top 6 teams. In fact, until today morning, we had it was a really tight competition between all the teams, and to actually select the top 6 teams from all the 66 teams was actually a huge task for us. But in fact, till today morning, we had like 2 or 3 question answer sheets on our hand, and then we were looking at, okay, which team should go to the finals and all that, and it was a really tough fight. But then today here we have our 6 finalists, and congratulations to the 6 finalists and all those who just narrowly missed out. Just give me a second, okay? Just give me a second.
I think by the time Giri joins back, I'll just inform you guys about the winners and the prize money and the how much incentives are the winners getting. So basically, there's a surprise gift as well. So the winners, as announced, the first positions will be getting a prize money of 3K and a subscription from Bhatia e-Gurukul of 3 months, and also PLA goodies. The second positions are getting a subscription from Bhatia e-Gurukul of 1 month with a prize money of 2K and PLA goodies. And also we have a surprise for the third and fourth positions today. The third and fourth positions shall be getting 7-day free trials from Bhatia e-Gurukul, each of them. So I hope you guys are excited. I guess Giri is back. We can start again.
Yeah, sorry for that minor interruption. So we have our top 6 teams for the finals today, and yeah, there were few teams who just narrowly missed out by the narrowest of margins. There's always the next time for you guys. There are always online quizzes happening, and once we are looking forward to better times, and we are hoping that we can have a live quiz as such in a place where we have and then we are all that is there for the future. So for now, very all the best to the 6 teams who are taking part in the finals, and there's always a next time for all the teams which just missed out. Okay, so going into the rules for the finals. Um, Congratulations to the finalists, as I mentioned before, and The finals will have 5 rounds, and the rules will be explained as we proceed with the rounds. And we've tried to keep the finals as it's not going to be too cumbersome, it's not going to be too long. We've tried to keep it as entertaining as possible, and we hope you guys like it. And Quizmaster's decision is going to be final on all the rounds and everywhere. And okay, before I go to the first round, first I would like all the finalists to introduce themselves. So and then also in the same process, you guys can check whether your mics are working and whether you're able to answer and whether you're able to hear me clearly. So team A, can we just have a brief introduction from you guys?
Hello, good evening, everyone. This is Simran Jain from KPC Medical College and Hospital, Jadavpur.
Hi, I'm Prithvi Basuroy, final year student, KPC Medical College and Hospital, Jadavpur.
Oh, okay, fantastic. Nice to have you guys here. Just mention which year students you guys are also when you're introducing yourselves.
Both of us from final years.
Oh, okay, fantastic. Okay, team B, can we have your introduction?
Hi, I'm Akshin Bhomik. I'm a third year medical student from Medical College.
Okay.
Hello everyone, I'm Prithvish Sanikrai. I'm a third year medical student at Medical College, Kolkata.
Okay, that's great. On to team C.
Hi, I'm Utsha Bhattacharya. I am a third year student from KPC Medical College, Kolkata.
I'm Soumya Bera, third year student from NRS Medical College.
Looks like we are having a lot of teams from Calcutta today. Moving on to team D. Team D, can you please introduce yourselves?
Hi, I'm Upamanya Nath, intern from NRS Medical College.
Okay.
Hi, this is Bhatia from NRS Medical College and Hospital, an intern.
Okay. Team E.
I'm from Coimbatore Medical College.
Third year medical student at Jipman.
Can we just have that introduction again? I think we missed it. Narayana Murthy, just introduce yourselves.
I'm this is Narayana Murthy from Coimbatore Medical College, third year. சொல்லிட்டேன்டா.
Yeah, it's cool.
Introduce yourselves.
டேய் அனி சொல்றா.
Hello, yeah, I'm Anirudh, third year medical student at Jipman.
Yeah, okay, cool. Yeah, so yeah, team F, can we have your introductions?
Hello, I'm Rimchim Kumar and I'm from Ramachandra Medical College. I'm a third year.
Okay, and your teammate?
Yeah, hi, I'm Alisha. I'm from third year medical. I'm in third year and I'm from Ramachandra Medical College.
Okay, fantastic. So now that all of our we have all the teams for finalists, all of them have introduced themselves. I would like to take this opportunity to also, mention, 1 second, we just had another team which really deserved to be in the final. I would like to give them a special mention over here. Just give me a second. Okay. Okay, so just wait. Just getting, I don't want to get their names wrong at the end of the day. I just want to tell the team. Okay, yeah. So yeah, team 34, Soumya Jyoti Raha and Somil Anshal. I'm so sorry, guys. You guys missed out by the narrowest of margins. Literally, team 34 and team 57 and team 16, all three of you guys were very close with all the answers. Team 34, if we really had a provision for having 7 teams in the finals, we would have you here today. But unfortunately, all of this was planned beforehand, and we've decided to have only 6 teams in the final. So I think we couldn't really accommodate you. I think Venkatesh and I, we really wanted to accommodate you guys in the final, but unfortunately we could not do that. But then brilliant quizzing, your answers in the prelims were excellent. I think all through you guys gave some amazing answers, and we are sorry that you missed out this time, and definitely there will be a next time for you guys. Okay, so, and my introduction here is not complete without introducing my the organizing team behind this quiz. So you can see here that's me, and then there's Venkatesh. We are the quiz masters for this quiz, and there's Neha. You'll be seeing her as Pounce Neha today. You'll be interacting with her today. She's also a third-year medical student from Ramchandra Medical College. She's also put in a lot of effort and helped us put together this quiz. And the others from the DFC organizing team, the entire organizing team has put in a lot of effort into this quiz, into organizing this quiz, right from the groundwork to the posters to the registrations and to the questions of the day, and all the things you saw on our Insta handle and our social media handles. Everything was taken care of by them. So Garima, Namrata, Roshmi, Dhruv, Devashish, Yash, Yachna, and Devamsh, all of them were so important in making sure this quiz actually came together and making sure that we had a prelims yesterday and we are having a finals today, and we will have many more events like this in the future. So I would like to take this opportunity to thank all of my all of the the background team which was involved in this quiz, and also special mention to Tirthankar Guha Thakurta sir. Without him, this quiz would not have happened. He is our mentor, a faculty who helped us, set up the questions, go through the final set of questions, tell if everything's okay and if the quiz is good to go, gave us a green light and everything. So I'm really grateful to him. And last but not the least, this is going to be there in every single online quiz I'm hosting. So just don't do it, guys, please, because as I said, a lot of effort has gone into it. And then the last thing I want you guys to be doing is, Googling this quiz. But today, you guys, just please take note, as all of you have your videos on, and then our volunteers will be checking whether you guys are attending this quiz legitimately. So if there is any sort of malpractice, if there is anything which is amiss, and then if it's noticed by our volunteers, then we'll be notified immediately, and I think they will be removed from the quiz, and that will be the quizmaster's decision. So please make sure that you attend this quiz legitimately. Okay, so Garimadi, are we good to go? Did I miss out anything?
No, we are very good to go.
Fantastic. Okay, so jumping right into the first round of the finals. Okay, so the first round of the finals, we are calling it It's a Six. So each team will get a question which will comprise of 6 clues. All of them point to a single answer, and the clues will also get progressively easier. So points will be awarded based on when the team gets the answer. For example, if the team gets the answer in the first clue, they'll be awarded plus 60, second clue plus 50, and so on. Once they guess the answer, they will have to stick on to the answer till the end to get full points and not change the answer at any point. Okay, so I think the rules, they don't look very they might look a bit complicated to you at this point of time. So we have a sample question for this round. So I'll just give you the gist of what I've just said before I jump into the sample question. So it's like we have 6 teams in the final, so there's going to be 6 questions, 1 question for each team, and each question will have 6 clues. And all the clues will get progressively easier. Like I'll start with a very hard clue for a particular question, and then as it goes, the 6th clue will be something very easy, something which will almost give away the answer as such. It will have the answer in it. So, however, and then all 6 of them point to a single answer. Like you have to connect all the 6 clues to get to a single answer. And then however earlier you get the answer, that much points will be awarded. For example, in the first clue, you're telling me the answer. And then one more catch over here is, if you tell me in the first clue, I won't tell you if you're right or wrong. You'll have to stick with that answer till I go through all the 6 clues. So let's say you're telling me the answer in the first clue. So I'll just show you the sample so that you get an idea. Okay, so this is the sample question we have. So I'm just looking at this, and I'm just saying that, okay, it's a metal, and then, okay, there's atomic number 30. So yeah, I know for a fact that it's zinc. So what do I know about zinc? Let's just say I'm taking a guess saying acrodermatitis enteropathica, because that's the only thing I know about zinc. So I'll ask you guys to give you your guess, and then you guys stick with that. And then I'll tell you guys to move on to the next clue. So here I'm just I'm just looking at this picture, and here you can see that there is a reverse transcriptase, a tagged DNA polymerase. I know that this is RT-PCR. This has something to do with RT-PCR, but I'm still not really, let's say, just for example, this is just a sample round. Just for example, I'm not sure how RT-PCR really relates with zinc and with acrodermatitis enteropathica. Just an example. So I'm just sticking with my answer, acrodermatitis enteropathica. moving on to the next slide. Okay, here I know for a fact that these are COVID toes, the characteristic dermatological finding which you can see in COVID. And now I'm trying to connect with all the clues which I saw earlier. I will like zinc, RT-PCR, and this. Okay, my connect has to be COVID-19. But then if you don't know that this is COVID toes, and you still think it's some other dermatological condition, it can be something else, you can still stick to it's all just an example. You can still stick to acrodermatitis enteropathica as such. Even if you don't know the answer, you can just stick to it as such, or if you have a different guess, you can go for it. So, but I know for a fact that it's COVID toes, so I'm saying that I'm changing my answer to COVID on the third slide. I'm going to the fourth slide, and then the fourth slide says world famous bath soup. And yeah, if you hear about bath soup, then I think whoever was thinking about acrodermatitis enteropathica also can change their minds and say bath soup, and your mind straight goes to COVID. So in the fourth slide, you'll actually change your you'll change your answer to COVID. Most of you will change to COVID, and then try to correlate with the earlier three clues you've seen, and then you'll say on the fourth slide that it's COVID. So, and then just like that, we'll go to the fifth clue. So here we have the cytokine storm, again related to COVID. And then the sixth clue is usually a giveaway. It almost has the answer. So here you can see the Corona brand here. So that is definitely COVID. So if you got it at the third slide, let's say, so I said COVID toast on the third slide and said that overall connect is COVID. So you will be getting plus 40 points because you got it on the third clue. It's like plus 60, plus 50, and plus 40. You get it on the third clue. In case you get it in the fourth clue, then you get only plus 30 points. You are not the points will decrease. One more thing to note here is there are going to be no negatives in this round. We are not going to give you any negatives since the first round we just made sure that there's not going to be any negatives. So it's just plus 60 to plus 10 till the last round as such. So, and then if someone got it at this slide, it'll be plus 20, and in the last slide it'll be plus 10. So on and so forth. That's how this round is going to work. So the answer for this is COVID-19, obviously. Okay, so if any of you have any questions, you can switch on your microphones and ask either of the quiz masters right now.
Are there past questions?
No, this won't be a past question. So like team A will get a question, team B will get a question, team C will get a question. Like each team will get one question. That's it.
Sir, I had one doubt.
Suppose
I say something at the slide A and I want to change that answer to something else in slide B, then can I change it?
Yeah, you can. You are allowed to change your answer. You can change your answer at any point of time. Also note that in case you are right on slide A, but then you changed it to something else, but you are wrong on slide B, then we won't consider the answer you said on slide A. Till I go to A, B, C, D, E, F, till I go to slide F, you'll have to stick to the correct answer. You should not change your answer. Only then I will be giving you the points. Is that clear?
And so, shall we communicate with our partner on the Zoom ID or like off it?
I think it's better you do the communication with the teammate off it on a separate phone call or something, because if you're discussing on the mic, then everyone in the call can hear it. So you don't want that to happen.
Sure. Yeah. Thank you.
Any more questions?
Voice clear?
One second, I'll be back. The 1 minute.
Yeah. Okay, sure, no problem.
Hello, Giri, is my voice clear?
I have a question.
Yeah, go ahead. This is, sorry, I can't, just give me a second.
I have a question. For each clue, do we have a designated amount of time, or like we can directly say if we don't get the clue, we jump to the next? Like, can we spend, like, there must be a time limit to each question.
Your voice did break a bit, but
Giri, I think he's asking if there's a time limit for each clue.
Time limit, not that will be decided as in, I won't be giving like I'll ask you for your guess because you'll be having your mic and video on the entire time of the question. So I'll probably give you like 30 seconds after explaining the clue to you for your guess, and then I'll move on to the next one. I won't be giving you a lot of time.
Like only when we want to answer, like I want to discuss it with my partner. So only when I have a concrete answer, I will turn on the mic and tell it to you. right?
Yeah, you keep your mics on mute when you're discussing it with your teammate, and then when you want to tell me your complete answer, you just unmute your mic and tell me. Yeah.
Okay, thank you.
Yeah. Okay. So I think Team E is back. Can we get started?
Yes, yes.
Okay, fantastic.
Okay.
So one more thing, there is no pass or anything. So Team A will get one question, Team B will get one question, Team C will get one question. There's no pounds or anything like that in this round. So one team will have to answer that question. That's how this round is going to work. So Team A, are you guys ready? Can we go to the first question?
Yes, sir.
Okay, fantastic.
Excuse me, please. Sorry, my teammate got disconnected. Can we just wait 1 minute? I'm sorry.
Yeah, okay, fine. Yeah, no problem.
Sure, we can. Yeah.
Yeah, sure. Make sure you guys have a stable net connection, like the best internet connection you can get in your house, so that you don't get disconnected from the call. Yeah.
Till then, I think everyone has understood this round. If you have any doubts, you can also let us know on the chat, so we can solve it as it goes.
I think Team F Alicia has rejoined. Can we start?
Yeah.
Alicia, can we restart?
Yeah.
Okay. Giri, please.
Okay. But yeah, right now I'll just need Team A. Team A, are you guys ready? Just
Yes,
need
sir.
a yes from your
Yes,
side.
sir.
Okay, fantastic. So going into the first question. Okay, this connective tissue pathology was historically associated with the Vikings due to its prevalence in the north of Europe and those of northern European descent. People with alcoholic liver cirrhosis have an increased preponderance to develop this condition. So usually the first clues will be something really hard. I think we've made it on purpose, and only if you have a really good knowledge of the pathology we're talking about, you'll be able to get it. So the things which you have to look at here is connective tissue pathology historically associated with the Vikings, very important in case that rings a bell, and people with alcoholic liver cirrhosis have an increased preponderance to develop this condition. In case you have any doubts regarding the clue or anything, you can always switch on your mics and ask me. Team A, do you have a guess for the first clue? Probably stay on this slide for another 15 seconds or so, and then I'll be moving on to the next one.
So we can move on to the next slide.
You do not want to, you can take a guess because there's no negatives or anything. So you can just take a random guess, whatever comes to your mind. Yeah, it might be right at the end. So yeah.
Scleroderma.
Okay, so you're sticking with scleroderma is Team A's guess. So moving on to the second clue. Okay, so the second clues, there may be 3 forms of this disease. So type 1, it is a very aggressive form of the disease found only in 3% of the people. It is often associated with other symptoms such as knuckle pads and Ledderhose disease. And type 2 is a more normal type of the disease, usually found in the palm only. This form may be made more severe by other factors such as diabetes or heavy manual labor. And type 3 is a mild form of the disease, which is common among diabetes or which may also be caused by certain medications such as anticonvulsants. I'll give you guys some time to discuss within your teammates, and then I'll be wanting your guess. So yeah, the 3 forms of the disease. is pretty clear. One second, I'm just getting something on the chat box.
Niemann-Pick's disease.
Okay, so you're changing your guess to the Niemann-Pick disease. Is that right?
Yes.
Okay, so our team may have changed their thing to the Niemann-Pick disease. And at any point, one more thing which I wanted to clarify. Please let me know if you guys want to look at the previous clues at any point of the question. I won't be going to the next clue, but I can go to the previous clue. So team A has given me the guess, Niemann-Pick's disease. Moving on to the third clue. Okay, so an analog of this disease at the penis is known as Peyronie's disease. And 30% of the patients with Peyronie's may also have X, which is the disease I'm talking about. It is a connective tissue disorder involving the growth of fibrous plaques in the soft tissue of the penis associated with trauma. So you can see a picture of Peyronie's disease, and then I've given you a clue that the analog of the disease in the penis is known as Peyronie's disease. So team A, would you like to change your guess, or would you like to stick with your guess? Team A, do you have a guess? I'll be moving on to the next clue now.
Sir, please wait.
Yeah, I can't give you guys too much time also. So.
Oh,
yeah.
Okay. So next slide.
So you'll just stick with Niemann-Pick's disease for now.
Yes.
Yeah. Okay. So moving on to the next slide. Okay. So the earliest sign of this disease is a triangular puckering of the skin of the palm as it passes over the flexor tendon just before the flexor crease of the finger at the metacarpophalangeal joint. So a very characteristic sign which is seen in this disease is a triangular puckering of the skin in the palm as it passes over the flexor tendon just before the crease of the finger at the MCP joint. So if you want to change your guess at this point, if you want to guess something, then please go ahead and give me the guess. Okay, I can also do this for the other teams who are watching us. Probably you can, if you guys have an answer, you guys can send it to me on private chat, and probably at the end of the question, I can tell who actually got it at which slide. So yeah. Okay, I have an answer here, a couple of answers here. Yeah, no points avoid. Sorry. The private chatting is just a formality, just to make it guys more just to make it more entertaining. No points will be awarded for the private chat, and I'm getting a lot of correct answers on the private chat. Fantastic quizzing, guys.
Next clue, sir.
I think everyone who's guessed the answer to me on private, all of you have got it right. Fantastic. Moving on to the next clue. No guesses from your side?
IgG4 mediated disease.
Okay, I'll keep that as your guess, and I will move to the fifth clue. Normally, the palmar fascia consists of collagen type 1, but in this disease, the collagen changes to collagen type 3, which is significantly thicker than collagen type 1. This is something which is very important in the pathogenesis of this disease. So, and I'm sure this clue will definitely ring a bell. So, if you guys can change your guess or stick to your guess, please let me know.
Already this time the previous slides and then try to connect all of them. So the clues here is collagen changes from collagen type 3 to 1, which is thicker. And the particular anatomical structure is shown in the picture. That can also be a clue for you guys.
Can you show the slides from the beginning once, one after the other, quickly?
Okay, fine. I can run through it really quickly for you guys if you want. Okay. So the first one is the connective tissue pathology with the Vikings Association. The second one is that there are 3 forms of this disease, and then aggressive form and normal form, mild form, knuckle pads, Ledderhose disease, and all that. And the third one is an analog of this disease, is known as Peyronie's disease. It's in the penis. And then the fourth clue is a triangular puckering of the skin. The fifth clue is that palmar fascia changes from collagen type 1 to type 3. So I've given you 5 clues so far. I'll just run through it really quickly. So can I have your guess, or do you want to stick to the guess which you gave me in the previous clue?
Next clue, we'll stick to it.
Okay, the last clue of this question. This is a really obvious clue. As I said, in all the questions of this format, the last question will be the last clue will be something which sort of gives it away. So if you can look at the picture and give me your guess, then you will be getting 10 points if you give me a correct guess at this point.
Progression of disease is shown here. And you can see specifically it affects 2 fingers. You can see the fingers slowly coming proximally.
Team A, I will need an answer from your side right now. Just look at the picture carefully and see which part of the body is affected. Like Venkatesh mentioned, the fingers are affected, and then you correlated it, all the clues which you saw initially. Then I think you might be able to get the disease.
This slide showed a particular anatomical structure, and if you know from first year, it's your palmar aponeurosis.
Team A, can we have a guess now?
Connecting everything.
So Dupuytren's contracture.
Okay, so Dupuytren's contracture is your guess, and Dupuytren's contracture is the right answer, explaining all the clues. So, and then, I think when I asked for the answers on the chat, team, I think that was the third or the fourth clue. I think Team E, Team D, and Team F, 3 of them got the answer right on the private chat. Really good quizzing. But then no points for that. No points for the answer on the private chat, like, because each team gets a question as such. So Dupuytren's contracture is also known as a Vikings disease because it was first prevalent in the Vikings and in people of Northern European descent as well, people who are descendants of the Vikings, and people with alcoholic liver cirrhosis also have an increased preponderance to develop Dupuytren's contracture. And 3 forms of the disease. So very aggressive form of the disease, Ledderhose disease is like plantar fibromatosis, and most of the cases you can also have both the hands and the feet may be affected. So that's the most aggressive type, and the other 2 milder forms of the disease. And the Peyronie's disease is an analog. You can see that there is a similar presentation in the penis, similar to the presentation which is seen in the palm. In the presentation, which is also seen in the palm. So this is an analog of Dupuytren's contracture in the penis, known as Peyronie's disease. And the fourth clue is that a triangular puckering of the skin of the palm is very characteristically seen in Dupuytren's contracture. And the fifth clue is that the collagen type 1 changes to type 3, which leads to thickening of the palmar aponeurosis, and as a result of which you get the characteristic finding which you see in Dupuytren's contracture. So Team A will get 10 points for this question. So now I will hand it over to Venkatesh to explain the second question to Team B. Team B, are you guys ready?
Yes, we're ready.
Okay, fantastic. Over to you, Venkatesh.
So our next question. The first clue is dash. A potentially fatal debilitating neurological condition was first described in 1950s by Victor and Adams. They concluded that it was a sequelae of alcoholics and malnourished patients undergoing swift treatment. So, yeah, this is your first clue. I'll give you some time for guessing. So the clues over here, it's a neurological condition. Then it occurs in alcoholics and malnourished patients as a result of treatment. So usually the first clue is difficult because we don't want you guys to get it in the first slide itself.
Okay, we'd like to guess Wernicke's encephalopathy.
What? Okay, Wernicke's.
Wernicke's encephalopathy.
Okay. Next clue. So second clue is, in this condition, multiple lesions are visible in the white matter. All lesions appear to be at the same stage of myelin loss and reaction, irrespective of space and time. So this is to differentiate from multiple sclerosis. So it occurs at the same time and also occurs at the same location because of synchronous onset of damage. So the damage is occurring at a particular point of time. So periventricular and subpar regions are spared, and is extremely rare for the process to extend below the pontomedullary junction. So I'll be giving you some time. So the clues here are lesions in the white matter, synchronous onset of damage, and periventricular subpar regions are spared. So all this to like basically differentiate it from a particular neurological condition. You're sticking to Wernicke's. Okay, fine. I'm getting some answers in the chat box, and that seems to be correct. Next clue. So one of the most dreaded manifestations of this condition is locked-in syndrome, also known as pseudocoma, which is a condition in which the patient is aware but cannot move or communicate verbally due to complete paralysis of nearly all voluntary muscles in the body, except for vertical eye movements and blinking. The individual is conscious and sufficiently intact cognitively to be able to communicate with the eye movements. So basically, in locked-in syndrome, the patient is fully paralyzed, but then he can only blink his eye. So the picture shown here is about for Jean Dominic Bobby, who's a person who suffered from locked-in syndrome. But then using just his eye movements, he was at the help of a person, he was able to write this book. This is an autobiography of this person, Driving Bell and the Butterfly. So that's like a great bits and writing the book. Okay, so any guesses, Team B? So this is the most dreaded manifestation of this condition. What you're talking about.
Yeah, we'll stick to our guess.
Sticking to one. Okay, fine. We got an next clue.
Yeah, sorry. Yeah.
Please observe this picture carefully, and something is happening over here, which underlies the disease process about what we are expecting to answer. So basically this happens in the disease process. This is one of the underlying pathologies which happens in the disease process. So you can see water is going inside, and you can see a few solutes, solvents. Water is going from extracellular space to the intracellular space. So this underlies the pathogenesis of the disease condition which you're talking about. Any guesses? Or do you want to stick to the same answer? You can see water moving from outside the cell to inside the cell.
The same answer.
Sticking to the same answer. Okay, our next clue. Hello, Giri.
Yeah, sorry, a bit of lag from my side. Yeah.
So yeah, the person is not important, but then please note like what he's holding in his hand. So this has got to something with the disease. It can be anything. It can be a histological sign. It can be a investigation. It can be a gross finding. So, but this has to do something with the disease. The person is not important, but note what he's holding beside him. And correlate with the previous slides and try guessing the answer. Something that's related to the disease. Any guesses, Team B?
We're sticking to the series.
Sticking to the series. Okay, fine. So yeah, so this picture shows you the whole disease process. So this is what happens in the disease. So you can see an astrocyte, and you can see water entering the astrocyte. Then there happens to be chronic hyponatremia in the surroundings. Then due to which you can see water entering the astrocyte, and you can see astrocyte is getting as death of astrocytes, and which causes disruption of blood-brain barrier. So like try correlating this with the previous slides. Like in the first slide I give, you had seen that it occurs as a result of prompt treatment for alcoholics and malnourished. So think of conditions for which they undergo treatment. So the case was first observed in alcoholics and malnourished, and also it happens to be still happens to be the common occurrence in those. And this is the whole disease process that's happening. So the one blanked out over here is the disease, actual disease. So any guesses? This astrocyte death, which causes the white matter lesions. It rarely extends beyond the pontomedullary junction. Osmosis is involved in the disease process. Any guesses, Team B? White matter lesions. Okay, so I'll give you another 15 seconds, and I want the answer.
Or we'll stick to our initial guess.
Sticking to Wernicke's.
Okay, moving to the answer slide. Okay, so yeah.
Answer is osmotic demyelination syndrome, which is also called central pontine myelinosis. It was its former name. So, note the explanation. So yeah, so here you can see it is debilitating neurological condition, and it's seen in alcoholics and malnourished undergoing swift treatment. So they are very prone to hyponatremia. So while you rapidly correct hyponatremia, you get osmotic demyelination syndrome. So yeah, so that occurs as sequelae to it. And second clue. So yeah, so you can see, so it's a demyelinating disorder. So there'll be lesions in the white matter, and all lesions occur at the same stage because of the simplest onset of damage. So yeah, we rapidly correct. So because of that, you get lesions which occurs at the same time. And then yeah, this was another clue for you guys. It rarely extends below the pontomedullary junction. That's why it's called central pontine myelinolysis, the former name. Then next clue. So yeah, so the dreaded complication of this condition is pseudocoma, also called as locked-in syndrome, in which there's total paralysis of the body and the patient can't move any muscles except the eye muscles. Next clue. So yeah, so this is basically osmosis that's happening here. So yeah, so there's hyponatremia outside. That's why the water is entering inside. So we all know that water goes from region of low sodium concentration to region of high sodium concentration. That's osmosis. So yeah, that's what's happening here. Next clue. And this is a trident sign that's characteristically seen in this disease. So yeah, so this is trident, and this is what we wanted to highlight. So next clue. It's an MRI finding basically. And yeah, this is the whole disease process happening. And so yeah, so astrocytes are damaged because that's why demyelination occurs, because asteroids basically they myelinate CNS neurons. So yeah, this is the whole disease process, and there's rapid correction of sodium. So it occurs as a result of treatment. So yeah, so on to you, Giri.
Okay, so I think Team B did not get any points in this round. Moving on to the next question, which is for Team C. Team C, are you guys ready? Team C?
We are ready. We are ready.
Okay, fine. Yeah, cool. Just give me a second. Yeah, okay. So moving on to the third question, which is for Team C. Okay. So the first clue, the name of this disease is a dash is derived from a dye extracted from the mucus secretions of the hypobranchial glands of a particular mollusk species, which is a Muricidae. This vibrant purple pigment, also known as Tyrian purple, was originally extracted by the ancient Phoenicians, Greek for land of purple, who lived around the regions of present-day Lebanon. The color itself varied a lot, but the most prized variation of Tyrian purple was that of blackish clotted blood. This dye was one of the reasons why the color purple became associated with royalty, owing to its expensive nature. So in the picture over here, you can see cloth which has been dyed with this pigment which I'm talking about, which is known as Tyrian purple. But then the name of this disease is, so there is a specific term for the dye which is extracted from that particular mollusk species, which is extracted from the mucus secretions, and the name of the disease is derived from that. And you can see that why it has been derived is that the color itself varied a lot, but the most prized variation of the Tyrian purple was that of blackish clotted blood. So this might give you a clue as to what this disease will be about. And this dye also was one of the reasons, and because of this reason, it was also because purple became associated with royalty. So that's a secondary reason. But the main things which you have to look at is that the color itself varied a lot, but then the most prized variation of Tyrian purple was that of blackish clotted blood as such. So Team C, do you have a guess based on this clue?
Purpura.
Do you you don't want to give anything specific? You just want to stick with that?
Yeah, for now. Purpura.
Okay. First purpura, right?
Sorry?
Your guess was purpura, right?
Yeah.
Hello? Yeah, okay.
Yeah. Okay. So Team C have guessed purpura. So I'm going on to the next clue. So yeah, this is just a picture of the ancient Greeks using this dye, which is known as Phoenicians. Sorry, who are known the dye known as Tyrian purple. So moving on to the next clue. Okay, so in this picture you can see two beverages which are given side by side, and I don't think I really need to tell what each beverage is. Let's look at the pictures carefully, and it will help you figure out what these beverages are and what's its connection. And you can try to correlate it with the first clue, and it is an important entity in the overall answer. So just look at the two pictures carefully and see if you can correlate it with what you saw in the first clue. Very important entity in the overall answer I'm looking for. So if you guys want to change your answer, you guys can change your answer, or you guys can stick with the same answer. Team C, can I have a guess from your side?
Is it Nivas?
I can't. Yeah, I won't be telling you guys. Yeah, there's one more thing. I won't be telling you guys whether you guys are right or wrong at any point of this. Only at the end, I'll be telling you guys. So your guess for now
is Nivas.
Okay, fantastic. So moving on to the third clue. Okay, so here you can see two substances which have been pictorially represented. These two substances have an important role to play in the to play in this disease. I'm just going to leave it at that. I'm not going to say anything more. So I'm sure by looking at these two pictures, you guys know what these two things are, and they have an important role to play in the disease. Just look at the first picture carefully. I mean, it might be daunting initially, but I think if you look at it carefully, you'll know what it is. Second picture is obvious. The answer is right over there. So see how you can correlate these two pictures with the overall connect and with the first two clues. If anyone else, if any other team knows the answer, you guys can private text it to me. I'll be letting you guys know at the end whether you guys got it right or not. Yeah. Team C. Oh, sorry. Yeah. Okay. Sorry. Team C, your guess. Slight glitch from my side. But
Hello.
Yeah, I can hear you.
Can you hear me?
Yeah.
Is it acute intermittent porphyria? Okay, that is our guess for now. Acute intermittent porphyria.
Okay, fine. That is your guess for now. So moving on to the next slide. So you can look in this clue. We are talking about how this disease has a similarity with vampires. So just like how vampires are sensitive to light, photosensitivity is a common feature in this disease.
Excuse me, my partner had just got disconnected.
Oh, okay, fine. Yeah, okay, we can wait for him then. Yeah, no problem. Organizers, please let me know once he has joined back into the call.
Sure.
Hello?
Yeah, I can hear you. Can you hear me?
Oh.
Okay.
Yeah, my partner has the answer.
Yeah, your partner did give me an answer in the last clue. Would you like to change your clue or stick with change your answer or stick with the answer for this slide?
I would like to change my answer.
Okay, yeah, go ahead.
Porphyria cutaneous tarda.
Okay, we will so I can fix that, right?
Yeah.
Okay, so this clue, yeah, I think I didn't explain it completely, but I think you've given me a guess before that. So moving on to the next clue. Okay, so it is thought that King George III of England may have suffered from this condition based on descriptions of his health that were written at the time of the American Revolution. Most notably, he suffered from episodes of excruciating stomach pain and episodes of delirium and agitation, which may have led to the bizarre decisions taken by the king, which earned him the title the Mad King Who Lost America. So, Team C, sorry. Would you guys like to change your guess or stick with your guess?
We stick with the answer.
You will stick with the answer. Okay, fine, fantastic. Last clue, look at this picture carefully. So you can see a particular substance which is being denoted here. So I don't think I need to give a further explanation for this. So would you guys like to stick to your answer or change your answer?
We stick to the answer.
Okay. Okay, so fine. The answer which I was looking for is porphyria in general, because I was talking about both the types of porphyria, like acute intermittent porphyria and porphyria cutaneous tarda. Because in the second slide, I think it was the second slide. Yeah. Yeah, so this is port wine colored urine, which is seen in acute
Porphyria
intermittent
cutaneous
porphyria.
tarda, porphyria cutaneous tarda, and tea-colored urine, acute intermittent porphyria.
I think it's, yeah. So we were looking for an overall answer, but Venkatesh, I think because a glitch from my side made them see the fourth clue when I was in the third clue itself. So I think we should give them points for getting it on the fourth clue. What do you think?
I don't think they really.
But we got it on the third clue. I was disconnected for a while.
Yeah, he was disconnected. They got it from third clue only.
Yeah, but the thing is, his teammate was there on the call. So the thing is, I didn't get an answer till then. But as soon as I changed the slide and got back to it, and I got an answer. So that is why I'm a little skeptical.
It's your decision.
But it's a mistake from our side, right? So I think.
Yeah. Okay. Yeah. It is a mistake from our side. Yeah.
I think they got it from here. That's what I feel. This is the treatment for porphyria, which is basically
Okay,
glucose.
fine then. Yeah, I mean because it's a glitch from my side, so yeah, I'll have to take the blame. But okay, yeah, I'll give you guys the points for getting it on the third slide. So that will be plus 40 to team C. I'll just explain the entire thing. So yeah, the name of the Greek term for the dye is porphyra. And porphyra is what porphyrin was derived from, and then porphyrin is why it's called porphyria. So the name of the Greek term for Tyrian purple is porphyra. And the second clue is port wine colored urine and tea colored urine, as Venkatesh told you guys. And the third clue, okay, this is the chemical structure of glucose, and this is hydroxychloroquine. Glucose, as you know, is used as a general treatment for porphyria. Hydroxychloroquine is specifically used in porphyria cutanea tarda. Similarities vampires, this was an easier clue. So photosensitivity commonly seen in around 3 to 4 types of porphyria. You do see photosensitivity, and people with porphyria cannot have for foods which are high in sulfur, and hence even vampires hate garlic. And yeah, because there is there's some sort of there's a heme deficiency, there's accumulation of heme precursors. It was believed that drinking blood could actually cure porphyria, but then it could also but then obviously drinking blood could not work out as a treatment, and it could also lead to death. And the fifth clue was about this. Yeah, he is known as a mad king who lost America, and some of his medical records, if you look at it now, it looked like he actually was a patient who was suffering from porphyria, and his symptoms do match with that. He had excruciating stomach pain and episodes of delirium and agitation and all that. So it is this also clearly points to porphyria. And yeah, this is the chemical structure of heme, which is an important part of porphyria. And so the answer we're looking for is porphyria. But you guys said porphyria cutanea tarda, acute intermittent porphyria. So, and then that was on the third slide. So I can give you guys 40 points for that. Yeah. Okay.
Thanks.
So yeah. So moving on to the next question, I think team D is going to be taking the next question.
Yes.
Okay, fine. Great that you guys are ready. So over to Venkatesh for the next question.
So, next question. Your first clue is common symptoms of this disease include migraine-like headaches and transient ischemic attacks. Sometimes patients may also present with unilateral cluster headaches with symptoms of restless leg syndrome on the contralateral side in severe cases. So the common symptoms of the disease is migraine-like headaches and transient ischemic attacks. So yeah, migraine-like headaches usually unilateral, but it can also be a cluster headache type. So yeah, these are the common symptoms of the disease, what I'm talking about. So I'll give you about 20 seconds. Any guesses, Team D?
Hello.
Hello, yeah.
Our guess for this option would be trigeminal neuralgia with autonomic symptoms.
Okay, yeah. Okay, so that's your thing. Okay. Trigeminal neuralgia. Okay, yeah, fine. Okay, next clue.
Yeah, 1 second.
Okay, so the second clue is one of the most common structures affected in this condition derives its name from the Greek word dash, which means stupefy. Apparently, it was believed that one could be put to sleep by manipulation of the structure. So this is a particular structure in the human body, which I'm talking about. And this structure is what is affected in this disease. So yeah, and the structure is derived from the Greek word, which is something, which means that a person can be put to sleep by manipulation of the structure. So I'll give you about 15 seconds. So this is the more structure that's involved in the disease process. Okay, so you want to stick to your answer? You want to stick? Hello?
Hello?
Yeah, you want to stick with your answer?
Yeah, we'll stick with this.
Yeah, okay. Next clue.
Yeah. 1 second.
So this picture shows you something that's involved in the disease pathogenesis. So you can see a human hand and you can see a ring on the hand. So yeah, so this is involved in the disease process. It has to do something with the disease. What?
Can we have the first slide, please?
Slide. Really rush really fast.
Sure.
So the common symptoms include migraine-like headaches and ischemic attacks. Sometimes, in severe cases, the patient is present with restless leg syndrome.
Yeah,
so
sorry. Yeah.
Next slide. Second one is it involves it involves something. Next slide.
Yeah.
So this has got to do something with the disease.
Yeah. Next slide, please.
You want to stick to the answer?
Yes, please.
Okay. So next slide. So yeah, this is a radiological finding which is seen here, and this is a particular plant, and you can see that it's a creeper. So this is somehow related to the disease what I'm talking about, and yeah, you can see your hyperdense regions on the radiological investigation. And this has got to do something with the disease. So this is, you can say it's something that's very characteristic of the disease. You can see the brain, you can see some changes in the brain parenchyma.
Okay, we'll stick with our answer.
Stick with the answer. Okay, fine. Okay, so this I'm showing this picture for a particular reason. You can see chimneys from a factory, and you can see smoke coming out of it. So I've given this picture for a particular reason. Note it's a neurological condition. It's affecting the brain. It's affecting a structure which translates to can be put to sleep. So that's involved in the pathogenesis.
Yeah.
You want to stick with the answer. Okay, next clue. So this is the entire pathogenesis that's happening in the disease. So you can see arteries coming, supplying the brain tissue. And you can see that there's an overgrowth of muscle within the artery. Just basically, arteriosclerosis is occurring in the artery, and this, it's carotid artery. So yeah, so this is the entire disease that's happening, shown here. You can see that there's overgrowth of muscle within the walls of the arteries, which leads to narrowing, which causes reduced blood flow. And you can correlate this with the previous slide, this finding with the previous slide. You can see that there are many new branches that are forming.
Okay, we'll change our answer.
Yeah.
We'll change arteritis, please.
You want to change it to?
Temporal arteritis.
Temporal arteritis, okay.
Go to the answer.
Go to the answer. So the answer is Moya Moya disease, which literally translates to puff of smoke in Japanese. So that's why that picture of puff of smoke. And yeah, the common symptoms of the disease include migraine-like headaches, which are usually unilateral, and you have transient ischemia attacks because there's reduced blood supply to the brain tissue because the carotid artery is involved. So that's one of the reasons. And next slide. And yeah, so basically the answer here was carotid. So the word carotid is derived from the Greek word karotikos, which means put to sleep, because by manipulation of the carotids, like it was thought to reduce blood supply to the brain, and the patient was found to get dizzy. So that was how the word carotid was derived from the Greek word karotikos. So next clue. And this basically I want to show you because ring finger protein that's involved in the molecular pathogenesis of the disease Moya Moya. So ring finger protein is involved in the pathogenesis. Then next slide. And this sign is called as the IV sign, seen on radiological finding, and it's very characteristic of the disease. So this is the IV plant, and this is the IV sign. This is due to development of collaterals. Because the arteries itself getting occluded, there will be development of collaterals. Hypoxia induces formation of collaterals. So yeah, so these are all the collaterals in the brain parenchyma. So next view. And yeah, this is the puff of smoke. So Moya Moya in Japanese, it really translates to puff of smoke. So that's why this picture. And next view. And this is the disease process shown here. Okay, handing it over to Giri.
Okay, moving on to the next question. Do we have team E here?
Yes, yes. Yeah.
Okay, okay, fine. So moving on to the first clue of the fifth question to team E. Okay, so according to the Bible, X is a wealthy and a prosperous man who is cursed by Satan with horrendous disasters that take away all that he holds dear. And one of the punishments left X afflicted with horrible skin lesions. Due to the similarity in clinical presentation, the disease has been named after X. So the first, the clue gives you insight into the question, saying that the X was a wealthy and prosperous man, showing that this disease has a biblical reference, and due to a punishment from Satan, X was left with horrible skin lesions, and as a result of which, due to the similarity in clinical presentation, the disease has been named after X, the biblical character. So, Team E, do you have a just let me know if you guys have a guess. I'll give you some time to discuss within your teammates. The picture is just does not really give anything away. It just added it. Satan.
Excuse me. Yeah.
Next clue, yeah.
No. We just want to answer for this.
Yeah. Okay. Yeah.
Leprosy. Is it leprosy? That's.
Okay. Leprosy is your guess for the first clue. Moving on to the second clue. Okay. So observe this. Observe this chart which is given carefully. This will give you a important clue about the disease. I'm sure all of you know what this chart is. Just try to get what clue we are giving to the overall connect from this chart, and you can also correlate it with the first clue and change your guess if you want to. this gives it gives an important clue about the overall connect which we are going for. So yeah. Team E, do you want to change your answer, or do you want to stick to the answer which you gave me?
Yeah, we want to change.
Okay.
Harlequin ichthyosis.
Sorry?
Harlequin ichthyosis.
Okay, Harlequin ichthyosis is Team E's guess. So moving on to the next clue. Okay, so in this picture, you can see that a certain process is being highlighted. Just look at the picture carefully, and you can figure out what is this a picture of. This process has an important implication in the disease process. So just try to look at this picture, figure out what this is, and try to connect it to the first two clues which we have given in this question. So this particular picture gives you an important clue about the overall disease, the overall connect which I'm going for. There are a lot of clues in this picture. Like, probably just look at the picture carefully, and then you can find out what this is. What is this a picture of? And then this picture is an important clue for the overall connect. Just giving them some time to discuss within their teammates. Keep sending in your answers on private. I'm sorry, I forgot to acknowledge earlier answers on private. I think Porphyria, a couple of them got it right. And even Moya Moya disease also, someone got it in the puff of smoke. Team A got it, and Team E got a couple of answers. So yeah, I will be acknowledging them. Don't worry. Okay, so Team E, do you have a guess? Team E?
Yeah, we want to change it.
Yeah, to what?
First, can we have a look at the second clue one sec for? Second picture.
Yeah, no problem. Yeah.
1 second. Yeah, third. Can you come to the third question?
Yeah.
We want to change it to. We want to change it to hyper IgE syndrome.
Okay, fine. Hyper IgE syndrome is your guess. Moving on to the fourth clue. So this is a characteristic of a feature which is seen in this disease. So if you can correlate it with what you have already guessed, or what are the clues which are given, maybe accordingly you can change your guess, or you can stick with the answer. Yeah. Just look at the picture carefully. The finding is given very clearly. So yeah.
Yeah, we would like to stay with the same answer.
Okay, cool. Moving on to the next clue. Okay, so this disease was first described in 1960s in two girls with red hair, chronic dermatitis, and recurrent staphylococcal skin infections, and pneumonia, abnormal inflammatory response, and hyperextensible joints. So here you can see a picture which highlights all these findings. So just look at all the clues which are given in the question: the chronic dermatitis, recurrent staphylococcal skin infections, pneumonia, abnormal inflammatory response, hyperextensible joints, and maybe you can change your answer or stick to the clue which you given. So, Team E, do you want to change your answer?
Yeah, we want to reset with the same option. We just need the next picture.
Okay, fine. Yeah, moving to the last picture. So yeah, all of us know who this is.
Yeah. Next, done. Job syndrome.
Yeah. Okay, fine. So I think they got it right on the. I think it was on before this slide. It was on this slide. It was on the third slide. So I think they'll be getting plus 40 for this question. The answer is job syndrome. I think someone answered it to me correctly on the private chat. Let me just go check. A Team F answered it correctly. I think, yeah, Team F also answered it on this slide as the correct answer as Job syndrome. So great quizzing. So just explaining all the clues. So this is Job. So Job was a biblical character who was punished by Satan because Satan just wanted to see how devoted Job is to God and whether he will ever curse God for what's happening in his life. And so this is a picture of Job being cursed with a horrible skin lesions, and it is due to the similarity. Cold abscesses are very characteristic with Job syndrome, and like the skin lesions which Job was afflicted with, it had a very characteristic clinical similarity. Hence, it was called as Job syndrome. Here in this pedigree chart, we've given you the clue that it's an autosomal dominant disorder. As you can see here, two affected individuals are giving one of their progeny is an unaffected individual. So the clue over here is autosomal dominant. And here, as you can see, there is the JAK receptors, and then there's a STAT here. So this is the JAK STAT pathway. So the JAK STAT pathway is very important in the pathogenesis of Jobs disease. And here, a very characteristic finding in Jobs disease is the presence of two rows of teeth. That is the deciduous teeth, the middle teeth, they fail to fall off, and then the permanent teeth like erupt even in the deciduous. So they have two rows of teeth. So that is another characteristic feature of Jobs disease. And this disease was first described in 1960s. And so you have the characteristic clinical findings here: the chronic dermatitis, staphylococcal skin infections, the cold abscesses. We didn't write cold abscesses here because it might have given it away in case they didn't get the answer earlier. And yeah, Steve Jobs is the last slide, so that is very much indicative of Steve Jobs didn't suffer from Job syndrome or anything. He died of pancreatic cancer, but this was just to give you guys the clue for Jobs, so that Job syndrome. So Team E got it right on the third clue. So Team E will be getting 40 points. Great quizzing. So over to Venkatesh for the next question.
Next question.
Team F, are you ready?
Yeah, we're ready.
Okay, fine, cool. Moving on to the next question. Over to Venkatesh.
So the disease bears your first clue for this question. Disease bears the name of British physician X, a neurologist who described the condition. So X's work had been predated by and drew on reports from a German psychiatrist, accounted for its resemblance to multiple sclerosis. And later studies also noted the hereditary nature of the disease. So yeah, the clues over here is described by a neurologist and resemblance to multiple sclerosis and the disease of a hereditary nature. So those are the clues from the slide. I'll be giving you, say, seconds. Any guesses, Team F? Team F, any guesses?
No.
Just you can give a random guess. Anything, something that brings bells. Neurological condition, hereditary nature. Some guess.
Ragged red fiber mitochondrial disease. I don't know.
MERRF, you meaning that?
Yeah.
Okay, yeah. Okay, next slide. Okay, so yeah, here you can see a peripheral smear from a patient suffering from the disease. So, and here you can see something that's shown here. So yeah, so this is basically the peripheral smear of the disease, what I'm talking about. And here you can see some RBCs and you can see some antibodies attached to it and a test tube, something. So this is the blood smear of the patient suffering from the disease. I'm giving you seconds. Any guesses, Team F? Or do you want to stick to your answer? Team F.
Is that schistocytosis?
Can't say that. Yeah, it's a peripheral blood smear of the disease. Closely observe the deformity. Yeah, so I need a guess, or are you sticking with the same answer? You can see RBCs, deformed RBCs. You can see few WBCs. Okay, moving on to next clue. Are you sticking with the same?
Yes, yeah.
So your next clue, the name of the structure is derived from a Latin word which loosely translates to shut with reference to its anatomical location. Characteristic to this disease, there's a thin rim of T2 hyperintensity seen in this region. So basically, this is a radiological finding what I'm talking about. You can see a rim of T2 hyperintensity in the region, and that region is derived from the Latin word which translates to shut. So yeah, so this picture is given for a reason. So mostly observe the picture and try to correlate it with the disease process. So you can see a thin rim of T2 hyperintensity on MRI. So any guesses, Team F? And that particular region is derived from the Latin word which translates to shut. This picture also is a clue. Any guesses, Team F? Or are you sticking to the same answer? Can you please answer fast?
Yeah, we're sticking to the same.
Okay, next clue. Okay, so one of the treatment options available for these patients involves administering X. So the name of the drug X is derived from Y, which is shown below here, as it was first isolated in the urine of patients who had taken Y. So basically, this is the substance Y, and the drug X is named after this substance. So because it was isolated from the urine of patients who had taken this substance. So this is was a very commonly used substance, but now it's lost its effect. And yeah, so this is highlighted. You can see the ring structure is highlighted. So this drug X, which is used in the treatment, is derived from this substance. So, and that's the chemical structure of the substance Y. So X is derived from this. So I'll be giving you 10 seconds. You want any clues or?
Yeah, can you give any clues?
I can say that concentrate on this part of the molecular structure. This is a very specific structure, and and there's a whole class of drugs coming under this. So this is a very commonly used, was a very commonly used drug, but now it's congeners are used widely. So I wanted to give, can you please tell me or guess? Or do you want to stick with the same thing? Concentrate on this ring, the two rings here. I want your guess fast.
Okay, yeah, we're just sticking to the same answer.
Okay, next clue. So this is a very characteristic feature seen in the disease. You can see what Donald Duck is doing here and two other birds also. They're showing some movements. So this is a very particular characteristic feature seen in this disease.
Okay, so that's asterixis.
Yeah, so I know, I mean, like, so what's your guess? Like, you want to change or do you want to stick to the same? something similar to, yeah, that you're coming somewhere close. Can you reply fast? You can see the movements the Donald Duck is doing. And Donald Duck is a bird, so it's moving its hands. Can you answer fast?
Autoimmune demyelinating, like an encephalopathy.
Oh, you mean AIDP? What are you saying? Autoencephalopathy in a sense? Team F, are you changing your guess or are you sticking to the same thing? I need your answers fast. I can't wait so long.
An autoimmune encephalopathy.
So you're changing your answer, right?
Yeah, yeah.
Okay. So going to the next clue. So yeah, so this is the disease. So
Wilson's
I'm familiar.
disease?
Yeah, it's Wilson's disease.
Fuck.
So going to the slides.
How is it like Wilson?
Yeah, like I'll explain. So yeah, so this basically this is a neurological condition and hereditary nature of the disease because ATP7B genes are involved in Wilson's disease. So it was and it resembles to multiple sclerosis, owes its name pseudosclerosis. So Carl Westphal, he's a German psychiatrist who named the disease pseudosclerosis because it resembled multiple sclerosis. So and it's hereditary in nature. Those are your clues here. So next slide. And can you go to the previous slide, Giri?
Yeah.
And this picture was like a clue because you'll see because there'll be bluish discoloration of your nails. It's called azure or sapphire nails, which is seen in Wilson's disease. So I just give it's a clue. And this is Coombs negative hemolytic anemia. So the Coombs test is negative, and there's hemolytic anemia seen in the peripheral blood smear. So this occurs in Wilson's disease, which is due to the high concentration of copper ions in the blood. So you see Coombs negative hemolytic anemia. So this is Coombs test and this is the hemolytic anemia picture. So next slide. And the name of the structure is basically colostrum is what is being we want to answer here. So colostrum is derived from the Latin word to shut or to close. So that's why it's called. So the word is close, clause, and yeah, so close, colostrum, because it's like on either sides of the globus pallidus and all that. So it's like it's closing the basal ganglia structures. So that's why it's called colostrum. So you can see a hyperintensity in this region. So next clue. And this is basically our treatment options, penicillamine. So penicillamine is derived from penicillin, and this is the structure of penicillin. This is the beta-lactam ring seen in penicillin. So penicillamine was named so because it was isolated in the urine of patients who had taken penicillin. So that's why it got its name penicillamine. So this is the treatment options, mainstay treatment, because it binds to the copper ions, chelates to it. Okay, so next slide. And this is the wing flapping tremor, which you characteristically seen in Wilson's disease. It's one of the symptoms the patients presents to. And the next, yeah, and this is Wilson from house. Okay, on to Giri.
Okay, I think we have come to the end of this round. Oh yeah, sorry, I forgot. I think someone did send in an answer. I think Team A, Prithvi Basu guessed Wilson disease. I think with the wing beating tremors, I think he guessed it as Wilson's disease. So yeah, that's great. So I think now we would like to have a look at the scores. Namrata, can you just give us give us the scores right now? We can see where each team is.
Yeah. Just. Is the screen visible?
Yeah, I can see your screen.
Okay. So team A has 10 points, team B 0, team C 40 points, team D 0, team E 40, and team F at 10 points at the end of round 1.
Okay, fantastic. We can see that Team C and Team E are taking an early lead. Team A and Team B and Team D are yet to open their account. Don't worry, guys. There's a lot of points still in store. There's 4 more rounds of quizzing which we are going to go through. So there's a lot of time for you guys to catch up. So on that note, we will be moving into round 2.
Just a minute. So,
yeah.
Could you just wait for, excuse me for 1 minute? I'll be back in 1 minute.
Yeah, sure, no problem. Yeah,
thank you.
No problem.
Giri.
Yeah, Narayanamurthy, yeah, tell me.
Same 1 minute after, right?
Yeah, sure. Yeah, no problem. Yeah, cool. Yeah, and just if you guys you guys want to let us know about anything, if you guys just want a small break or have to attend to something, just let us know. It's not a problem at all. We can wait for you guys.
Thank you for waiting, sir.
Yeah, no
good to go.
Yeah, you guys don't need to address me sir and stuff. I think some of my seniors are also here, so yeah, it's still a very chill quiz and all that. So yeah, you can just call me Giri and you can call Venki, it's fine. So yeah, we don't need formalities over here. Okay, so yeah, team E, are you back?
Yes, sir. Okay.
Yeah, okay, fine. Okay, cool. Then we can get started with the second round. So I think team C and team E were on 40. They are leading for now. So I'll just go ahead and share my screen. Okay, so this is the second round. So I think you guys got a glimpse of this round in the prelims. We had a couple of questions in the prelims which were based on this concept. So good old 4 pictures and 1 word. So connect all the pictures to a medical entity. It can be an organism, it can be a disease process, it can be anything. It can be absolutely anything. And each picture also can stand for absolutely anything, something anatomical, probably something from microbio, a pathological body, a radiological finding, a clinical finding, a sign, anything. It can be absolutely anything. So in this round, I'll just be explaining the rules of how we are going to be going about it. So for this round, we'll again start with team 1. So each team will get it, and then this round will have 6 questions because we have 6 teams. We'll have 6 questions, and each team will get a direct. So the first question will start with team 1. It'll be team 1's direct, and after which the questions will go around in a clockwise manner. So team 1's direct, and then it'll go to team 2, team 3, team 4. It just keeps passing on, and there is no pounce in this round because for a connection as such, usually pounces will be complete answers, and I think we'll have to give you guys a lot of time, and it'll be cumbersome to actually type in the connects and all that. So we are not going to be having pounds in this round. So start with team 1, and then each team will get a direct question because we have 6 questions in this round, and if team 1 if they answer it on the direct, it'll be plus 15 points, and then if another team answers it on the pass, it'll be plus 10 points. So, and then the question will keep passing until till all the teams have got a chance to answer, or it will be closed if one team answers before that. And here an additional 5 points will be given for the team which gives the entire explanation. So this additional 5 points is available only for the team which gives me the connect. I'm not going to be it's like a bonus point for the team which gets the connect first. So it's like I'm not giving extra points for someone who does not get the connect but might just know the explanation based on someone else getting the connect. So if you get the answer, that is if you get the overall connect for the 4 pictures, then if you can explain to me what all those 4 pictures stand for, then I can give you an extra 5 points. So this is what this round is about. Do any of the contestants have any queries? Then you can ask me right now.
There's no negative marking, right?
Yeah, no negatives, absolutely.
Thank you.
Is there a time limit?
Yeah, we will be having an approximate time limit like how we had for It's a 6. So we'll be letting you know when I'll be passing it to the next team. I'll give you guys just enough time so that you guys can just discuss the answer with the teammate, and then
also depends on the difficulty level of the question.
Yeah, if it's okay, we've tried to maintain a uniform difficulty for all the connections, but some might be a little easier, but then we will give time accordingly. So regarding this entire quiz, regarding the time for each question is going to be variable, because the difficulty and everything and the type of question is going to be variable. So we will let you know when we are closing the question, when we are passing the question. Okay, so moving on to the first question. This first question will be team 1's direct. Okay, so you can see 4 pictures over here, and I think they are pretty clear. Like, see a statue here, and then there's a flower, then there is this thing. Because if I say anything about the picture, then it might give away the answer. So just look at these 4 pictures carefully and try to connect all these to a particular to something which you can see in medicine. It can be absolutely anything, like I mentioned before. It can be a radiological sign, a clinical finding, something anatomical. It can be absolutely anything. So this is team 1's direct. So I'll be giving you guys about 30 seconds to discuss this question with your teammate and give me the answer. So this round will have all of you have to be ready. It was not like the previous round where it's just one question for one team. So if team A doesn't answer it, I'll be passing to team B, team C, team D, like that. So all of you be ready. All of you be ready with your answers. Team A, are you guys there?
Yes.
Okay, I will be needing an answer from you in another 20 seconds or so.
Adenomyosis.
Do you want to explain? Do you want to try explaining
the
why?
Buddha sign is seen in adenomyosis, which is apparently seen in the USG of adenomyosis of the uterus, and radiological finding being the Buddha sign also. I can't make all the connects, but I think.
Okay, so passing it to team B. Team B, are you here?
Yes, we're here.
Yeah, so what is your guess?
Infective endocarditis.
Okay, do you want to give me an explanation as to why?
You know that was just a guess.
Oh, it's just a guess. Okay, no problem. Passing to team C.
Pass.
Okay, passing to team D.
I think this can be Crohn's disease because it's a rose thorn appearance seen on X-ray, and the cheese, the food that is there is showing skip lesions, and the inverted bowl appearance I think is of the abscess ulcer. It is showing the crater, and golden sign, the Buddha. I think I can't explain. So.
Okay, good guess. You tried connecting 3 of the pictures and coming at the answer. But we will be passing it to team E. Team E, do I have a guess from you?
Yeah, we would like to say, Crohn's.
Like Crohn's disease. Do you want to try explaining it? Do you want to give a different explanation?
No.
Or? No. Okay, fine. Passing it to team F.
PCOS.
Okay. Do you want to give any explanation as to why you think it's PCOS?
Sorry, just pass.
Okay, fine. It's okay because there are no negatives around, so feel free to guess. The answer which I was looking for is leprosy. So as you know, these are characteristic features which are seen in for different types of leprosy. So just going back to the picture. So Buddha ears is Buddha ears. Then the rose at the end of the stem and then inverted saucer and Swiss cheese. That are the characteristic findings as seen in the different types of leprosy. As you can see, lepromatous, tuberculoid, mid-borderline, and borderline tuberculoid. Anyway, Crohn's disease was a very close guess because it connected 3 of the pictures, but then the Buddha ears did not really have a connect in that aspect. So the answer which we were looking for is leprosy. Okay, over to Venkatesh for the second question. This second question will be Team 2's direct. Okay, second question coming up.
This is like the previous question. You can see 4 pictures over here, and they are basically self-explanatory. So I'll be giving you 20 seconds. You can see a tree in the first picture. Second picture, I think everyone is familiar with the character. Third picture is obvious, and even the fourth picture, you can see something that's burning.
Hello, we have an answer.
Yeah.
We will answer Bacillus anthracis.
And do you want to explain the answer?
It gives inverted fir tree appearance on culture.
Okay.
And at the edges of the culture on nutrient agar, there is a medusa head appearance.
Okay.
And I am guessing the malignant pustule appearance looks like something like necrotizing coal-like appearance, and the letter I'm guessing it's something to do with the bioterrorism.
Yeah, and you're absolutely correct. It's Bacillus anthracis.
Yeah, I think because they answered their direct question and also gave the full explanation, it will be a 15 plus 5. I think they'll be getting 20 points for this question. So yeah, that was a really good explanation for connecting all the 4 pictures, and it was a great answer. 20 points to Team B. So moving on to the third question in this round, direct to Team C. Okay, so look at these 4 pictures carefully. So the first picture, people from the south will know who he is, but then I think it's not important as to who he is. Just observe his hairstyle. And the second and the third pictures are obvious. You can just look at them carefully, and you will be able to understand why it is there in this connect. And then the fourth picture also highlights a particular anatomical entity, and I'm sure all of you guys know what it is. So this is Team C's direct. So Team C, I will be giving you guys 30 seconds to discuss this question within your teammates, and then you can give me an answer. Team C, are you there?
Yes, we are there. Just a minute. Just a second.
Yeah.
We'd like it as a carotid tumor because
okay. Do you want to explain it?
On patient, the feel is like a potato. It originates from the glomus cell.
Sorry, I can't hear you. I think you're.
On palpation, the feel is like a of potato, and it originates from the glomus cells.
Next.
I can't. Your voice is breaking a bit.
Hello.
She's saying that it's a carotid body tumor. It's on palpation. It is a sack of potato feel. They appear from the glomus cells, and I don't know about this guy.
You need to explain all the 4 pictures for getting the best 5 points.
For the extra 5 points. Yeah.
The answers correct.
I'm sorry.
You have to be explaining all the 4 pictures to get the best 5 points, provided your answers correct. So, you want to explain, or that's it?
Just give us a second.
Like I said, that has nothing to do with the guy as such. So yeah, just look at. I did mention it before. I don't want to. It might make it a bit obvious. So yeah.
Stress probably has turned his hair white. I don't know. We can't explain.
Okay, fine. No problem. So I think they've got the answer right. That is carotid body tumor. Yeah, we can take it as right answer. But then because paraganglioma. But then what we were expecting was salt and pepper appearance for his hairstyle. He's known to have a salt and pepper appearance. For people from the south will know him. Like they'll know him a lot. But then, a ball of cells is a Zell ball in appearance, and then is also known as a potato tumor. And yeah, this is a carotid body. So most common paraganglomas are from the carotid body. So they got the connect. So that will be plus 15, but they could not get the extra 5 points which was there for the explanation. So that will be 15 points to team C. Yeah. Over to Venkatesh for the next question. Team D, are you ready for your direct? Team D?
Yeah, you're ready.
Hello?
That's right. Yeah, they're ready.
Okay, yeah, I couldn't. Yeah, it's breaking a bit. Okay, next question. Yeah.
So you can see 4 pictures over here. You can see in the first picture shows a baby with some some dermatological condition, and in this picture you can see an animal, and here you can see a heart holding a stop sign, and over here if you're familiar with Game of Thrones, this is the sigil of House Stark, and you can see there's something that's shown in the sigil that's related to what I'm talking about. So connect the 4 pictures and come up with something that connects the 4 pictures. Okay. I'll be giving you 20 seconds for this. The symbol and the sigil is more important. Nothing else is important. And then the animal, baby with some dermatological condition. Any guesses, Team D?
We're going with congenital rubella.
Congenital rubella. Okay. Okay. So you want to explain?
Rashes.
Sorry, I can't hear you.
Hello.
Hello. Yeah.
Am I audible?
Yeah. Audible.
Yes. We see rashes on the baby.
Okay.
Just guess, like there's a heart, so it's affecting the heart probably, and it causes cataract. I think the House of Stark shows a white eye.
Okay.
I'm not sure about the other.
Yeah, I'm going to pass the question to Team E.
Yeah.
Team E, any guesses?
Yes. Yeah. Hello. Yeah, is it audible?
Yeah. Audible.
Yeah. Is it neuroblastoma?
Neuroblastoma. Can you explain?
Blueberry muffin rash. That's blueberry muffin baby. Or then raccoon's eye.
Okay.
Then is it heart block? I don't know about the House Stark thing. Yeah, heart block and raccoon's eye.
Okay. I'm going to pass the question to Team F. Team F. Hello. Hello, Team F.
Oh yeah. Neonatal lupus syndrome.
Okay, can you explain the
Yeah. Okay. Because it's heart block, raccoon eyes, and I think because of thrombocytopenia, they have a rash. I don't know how House of Stark is related.
Okay. You don't know how. Okay. So yeah, the answer is correct. It is lupus, neonatal lupus. But then I can't give you the +5 points because you couldn't explain the wolf part. It's basically lupus means wolf. So yeah. So neonatal lupus is correct. Hello, Giri.
So I think team F will be getting plus 10 points for giving us the connect, but they couldn't explain it, so they won't get the bonus 5 points. So moving on to the fifth question, which is team E's direct. So yeah, fifth question. Just look at, we are familiar with all these 4 pictures. I'm sure all of us are familiar from the first character from our childhood. And then second picture is also obvious what it is. Third picture is a picture of a bird. And then the fourth picture also gives you a very important clue to the overall connect. So team E, I'll give you about 30 seconds to connect all the 4 pictures and give me what the connect may be, and also give you a chance to explain the entire connect. Just look at the pictures carefully and just find out why we have put each picture in this question, and then try connecting them all, and I think you should be able to get the answer. Team E, do you want to take a guess?
Yes. Okay. Is it psittacosis?
Sorry?
Psittacosis.
Psittacosis. Do you want to explain the connect? Why you're saying
parrot beak appearance.
Okay.
Then I guess it's saddleback fever or something, maybe.
Okay. Other 2 pictures, do you have a...
No, I don't have an idea about those.
Okay, fine. Passing it on to team F.
Mache?
Team E, mute yourselves. Yeah, okay. Team F, do you guys have a guess?
Okay, we also think it's psittacosis, but it's because psittacosis is because of parrots. There's a saddleback fever and that Kirschman spirals in the sputum. I don't know. No.
No, that's not the answer I'm looking for. I'll just pass it to team A. Just one more thing. If the connect is correct, I will stop it with that team. I've been doing that and then that team alone gets a chance to get the extra plus 5. Because once the connect is figured out, then it becomes sort of easy to get all the explanations and all that. So only the team which is answering the connect will get the chance to answer the explanations. Yeah. Team A, do I have a guess from you?
To go with Parkinson's plus syndrome, maybe, because the parrot sign, it's because of midbrain atrophy on MRI. So.
Okay. Do you have an explanation for the other 3 pictures?
And that looks like
eye of tiger sign seen in the eye of tiger sign seen in multi-system atrophy, and the saddle.
Okay, fine. Good guess, but we will pass it on to team B.
We would like to guess neonatal syphilis because of Sabershins. That's a connect with Diego, and saddle nose deformity, and we don't know the other 2.
Okay, so yeah, I can give you points for neonatal syphilis. Neonatal syphilis is absolutely right. But then, yeah, you got Sabershin, you got saddle nose. This is parrot node, which is seen characteristically in the skulls of the neonates who have congenital syphilis. And then, yeah, that was just a spiral, which to stand for spirochete, because syphilis, Treponema pallidum, is a spirochete. So the fourth picture was just a spiral. Great that you got the first 2 connects, but then the second 2 connects you could not get it. So just for the connect, team, I'm sorry, was it team B or team C?
We're team B.
Yeah, team B. Yeah, sorry. Okay, so team B gets plus 10 for getting the connect on the pass. So over to the next question, which is I think Team F's direct. Over to you, Venkatesh.
So our next question. Here you can see a picture of a man. Then I think it's obvious. So the picture over there shows a board in which something is written, public display of affection. So and then the last picture over here is, you can see something it's pouring down, and you can see a waterfall. Something is pouring from the bottle, and you can see a waterfall. Then you can see the flag of some country. This is slightly difficult, so I'll be giving you about 25 seconds. If you want any clues, you can ask.
Yeah, what are the clues?
Yeah, like the picture over there shows a board, and don't take the literal meaning of that. Like basically, I can say it's an acronym of the words written there, something like that. So I want you to tell the acronym. You can take it that way, like the acronym of the words written on the board. And the first picture is of a man, and there's something characteristic about him. That's why we have shown this particular man. And yeah, country's flag. And the last picture is something is pouring from the bottle, and you can see a waterfall. It's forming a waterfall. And I can tell you the picture in the billboard is some pathology related to one of the systems in the body. It most commonly occurs in this particular thing what you're talking about. It's a specific anomaly, particular system in the body. Any guesses, Team F? And yeah, that's a country's flag, and if you're familiar with it. I think the picture, the billboard only is difficult in this question. So I've also told you so many clues. It's a specific anomaly occurring in a particular system of the body, which is characteristically seen in this condition. It can be a condition, it can be anything. Your investigation can be an organism, it can be anything. Do you have an answer, Team F?
I don't know, just guessing by PDA, like patent ductus arteriosus. Is it like carpopedial spasm? I don't know what the picture is doing, but yeah. And then the flowing milk, is it like something pathology to the heart, like gushing?
You have an answer? Like, okay, what's your answer? You're explaining the connects, but you explain the pictures, but do you have an answer?
Rubella? I don't know. German measles or rubella, something like that. Is it like it causes a heart? Patent ductus arteriosus is what you get in the kids, and it's German measles. And I'm guessing that it's like a murmur that comes is like the waterfall. I'm not sure about that.
First picture.
First picture.
Hello.
Yeah, we're just thinking for the last picture.
I can't give you so much time.
Okay, yeah, so we're answering German measles rubella because it's Germany and patent ductus arteriosus is seen on the thing. So we made that connect. Yeah.
Okay, so yeah, the answer is correct. It's German measles. So Giri, go ahead and answer, please.
Yeah, sure.
So the first picture shows a Roman person. He's wearing a toga robe. So this virus is called. It belongs to the class Toga Viridae because it's encapsulated. And German flags, German measles, and patent artery was seen in conjunctival spectrum. And milk says you can see a bottle of milk and it's pouring down. It's forming a waterfall. So basically, milky cataract is seen in congenital rubella, and basically the word cataract is derived from the word waterfall. So yeah, it's milky cataract, German flag, and patent arteriosus and toga robe. So yeah, so I can't give you the plus 5 points because you didn't explain fully. But yeah, I get the points for the answer.
Okay. So I think that brings us to the end of the connections round. We got some really good answers in this round, and I think some teams have opened their account and are in the competition. So here we will take a look at the scores and see where each team is at. Namrata, can you just share your screen and
Yeah,
show the
sure.
scores?
Team F got?
Team F, I think on the direct got the connect, so it was plus 15. Yeah.
Plus 15. Okay. Sharing the screen now. Okay, can you see the screen?
Yeah. Okay. So team A is on 10 points. Team B is on 30 points. Team C is on 55. Team D is on 10. Team E on 40, and Team F is on 50. I think. Okay, yeah.
15 plus.
We got
I
a
think
past
10 plus.
question also in between. I think we got plus 10.
Yeah, the past question.
Yeah.
And the past question. So it's plus 10.
For which team?
For F.
Plus
10.
10 more points, I think. Yeah.
Yeah.
So I think 35 points. Yeah. Okay. So right now, Team C has taken a lead with with 55 points, and then I think we have Team E on 40 in second, I guess, and then Team E is on 35.
F is on 35.
Oh, sorry. Team E is on 40 and Team F is on 35. Okay, fantastic. So how are you guys finding the quiz so far? All the questions are great. Is it entertaining? Team A, can you just switch on your mic and just let us know how the quiz is so far?
The questions are like a bit on the tougher side for us. Like we can't really connect on our question that much, but yeah, it's going good overall.
Okay, fine. Fantastic. Can I hear Team B's comments as well? Team B is here.
Yeah, the quiz has been really enjoyable so far.
Okay, fine. Okay, great. So I think with that, we are ready to go into the next round.
No.
Okay, I think Team E said that they were just going off for a while. Is Team E back?
Yeah.
Yeah. Cool. Okay.
This is Team D. Am I audible?
Yeah.
There's some issue with my internet. Can I just check it for 5 minutes? Like 1 minute? There's some issue with my internet.
Yeah, sure. Just let us know when you're back. Yeah, no problem.
Yeah, this is Team D. I don't think we got 10 points for any of the answers. The scores show 10 points.
Team, which team is this? Team D, yeah? Yeah. Scorers, can you just check that for a second? Yeah, thanks. So Team D, I think, okay. I'm not sure which question.
I think I got it.
No, I think Team D, according to what the scorers are saying, got a question on the past, but then
I think they got congenital syphilis, right?
I think that was Team B. Team B got congenital syphilis. Because I think as far as the connects went, I think nobody got the leprosy connect, and let me just, I think nobody got the leprosy connect. I think the congenital rubella direct was 15, and let me just.
What question do you like? You're expecting from us?
No, I think Team D is saying that they didn't get any question right. Is that what you're saying, Team D?
Yeah.
Zero.
Okay, then. Yeah, sure. I'll just run through the questions real quick so that I'll sort of get an idea of who answered what. Yeah, 1 second. Okay, just bear with me for a second. I think nobody got the leprosy. Nobody got the leprosy connect. I think this one team B got it on the direct, and yeah, just give me a second. Yes. Just give us a second. We're just sorting it out. I think this also Team C got 15 points for explaining just the connect, and I think this question also, I think Team F got it right. Am I right, Venkatesh? I think Team F.
Team F
got it
This
right on
was
the
Team
pass.
D's direct.
Yeah, and then this one, I think Team B got it. B for Bombay. I think they got it on the pass. And this one also Team Team F got just the points for the connect. Okay, yeah, cool. So yeah, I think Team D did not score any points in this round. So scorers, can you just show me the updated score list, the updated score table?
Namita, could you please share your screen once with the score?
Just a second. Yeah.
Okay, cool. Okay. Yeah, Team D, I really appreciate you guys for being really honest about this quiz, because I know most of the teams would have just taken those free 10 points and would have gone with it. But then thank you so much for, I really appreciate how legitimately you guys are doing this quiz. So a separate shout out to you guys. So Team D, yeah, yet to open their account, but then I'm sure there are 3 more rounds of quizzing left, lots of points up for grabs. So I'm sure you guys can catch up with even the team which is leading right now. Actually, they've just got 55 points. I think you can make that up in the next 3 rounds. We will see how it goes. Okay, so moving on to the third round of this quiz. I shall share my screen now. Okay, so the third round, we are calling it a spin the wheel. So in the next slide, I can show you this. I'll show you the slide in a bit. Each team will get a chance to spin the wheel. The question will be displayed according to the organ system they get. The question will be that team's direct, which is plus 15 on direct or plus 10 on pass. And teams can also answer through pounds before the teams answer the question on the mic. So here for this particular round and the next round, which we are calling unravel, we are going to be bringing in the concept of pounds. So I think there might be a situation in this particular round where I might start with team 1, but then team 6 may know the answer, and they might not actually get a chance to answer it on the pass because someone before them already gives the answer. So this is why we have the concept of pounds in this round. So how pounds is going to work is, so the question will be displayed on the screen. Either Venkatesh or I will explain the entire question, and once the question is explained and once we've given all the clues, we will say pounds open. So once we say pounds open, note that in your participants list, you can find someone called Pounds Neha. So Neha's also been helping us with the quiz. So she's pounce Neha for this quiz, and you'll be sent. And then after I say pounce open, you'll have to send in your answers privately to pounce Neha on the Zoom private chat. And when you do this, you have to do it only if you are very, very sure, because there will be negative points if you get the answer wrong. So for the answers on the pounds, the scoring scheme will be +10 and a -5. Okay. And when I'm opening the pounds, I'll tell you guys how many seconds you guys have for pouncing on that question. And then I'll give a countdown saying that 5, 4, 3, 2, 1. And Neha, are you there?
Yeah, I'm there.
Okay. So when I say 5, 4, 3, 2, 1, pounds closed, Neha will send a message on the chat box saying that pounds is closed. So Neha, can you just
Send a message?
Yeah, just send a message on the chat box. Just send a message on the chat box. So yeah, you'll be getting a message when I give the countdown and I say pounds closed. Neha will be sending a message on the chat box saying pounds closed, after which we will not be accepting any probably again 5 seconds buffer I can give you guys, but then will not be accepting any more responses after Neha says pounds is closed. And if it's like maybe 5 or 10 seconds, but then definitely not more than that. And please note that you will be pouncing only if you are very sure of the question. That is, only if you're 100% sure of the answer, you will be pouncing. And a few questions might have a little variations in this. I will tell them, but these are the general rules for this round. So you will be sending in your answer, and then after the pounds is closed, I will be giving it to the direct team. That is, let's say spin the wheel, will be starting again. We'll start with team 6 this time, because first 2 rounds we started with team 1. We will start with team 6. So when you say gives team 6 is direct, then team 6 can again. So yeah, one more thing which you have to note over here is that you don't need to pounce on your own direct. So even if you know the answer beforehand, you just keep it with yourself if it's your direct, so that you can guess it. You don't need to take an additional risk of getting a negative points. And plus, if it's your direct question, you'll be getting plus 15 points anyway. That is more than a plus 10, which you might get on a pounce. So once team 6 answers their question on the direct, it'll pass to the next. I'll be going anti-clockwise, so it'll pass to team 5. And one more thing which has to be noted over here is if a team has already pounced, they won't get a chance on the pass. So let's take a scenario like this. I'm showing a particular question, and then I'm opening pounds, and then let's say teams 2 and 4 are pouncing on the question, and then pounds is closed, and the direct goes to team 6. Then after, if team 6 doesn't get it right, then I pass it to team 5. Then I won't be giving a chance to team 4 because they've already pounced the question. So it'll go to team 3, and then whenever the right answer is said, the round will end over there. And then yeah, team 1 will also get a chance in case the right answer hasn't come by then.
Can you please repeat this instruction once again?
Yeah. So if you pounce, that is when I say pounce open, and then before I say pounce closed, you send an answer on private Zoom chat to pounce Neha on this Zoom meeting. Then it will be you can't answer on the pass. If you pounce, you can't answer on the pass. You won't be given a chance on the pass. All the other teams will be given a chance. And if you're answering on the direct or on the pass, then you won't be given any negatives. But if you're pouncing, you'll be given a negative. So pounce only if you're very sure of the question. So are there any doubts regarding this procedure?
Yes. Just pounds carries negatives, right? Not the direct and the pass.
Yeah, the direct and the pass don't have negatives. Only the pounds will have negatives. Anyone has any more questions?
We have to reply on the direct only after pounce is over, right?
Yeah, only after I'll say pounds open. Venkatesh, I'll say pounds open, pounds closed. I'll say it's team 6 is direct or team 5 is direct. Sorry. Okay, we are going A, B, C, D, E, F. I'm so sorry. So team F's direct, team E's direct. So whenever I say team F's direct, only you will answer. You should not, only after I say pounds closed, the question is open to all the other teams who will be answering on the direct or the pass. So if there is someone who's telling out the answer before I close the pounds, then I'll have maybe I will first 1 or 2 times. It's okay because you might be new to the format. But then if it occurs again and again, then I might have to give that team negatives because it's rules of the quiz are as such. So only after bottom line, only after I close the pounds, you will be able to give your answer. Do you guys have any more doubts regarding this round? So I think that's that. You guys can also send me if you guys have any doubts, and you can also send it to me on the chat box. But seeing that I think all of you are good to go, I think, yeah, so I'll just show you guys how this round is going to look. Again, just going through the point scheme. So plus 10 minus 5 on the pounds, direct question will be plus 15, and on the pass will be plus 10. And can you guys just send a test message to Pounds Neha, and then we can just check with Neha whether she's getting all your responses. Oh, I'm sorry. Yeah. Neha, are you getting responses?
Yeah, I got from team A.
Okay, just let me know once you've got test messages from all the teams. Yeah, one more thing which I wanted to clarify is, so when you're pouncing, just make sure that one of the teammates is usually sending in the pounce answers, because if there are two answers being sent, then we'll only consider the answer which has been sent first, and then that might end up giving your team a negative point. Even if the second answer is right, we won't be considering it because an answer was sent before. So make sure that just to avoid any confusion, just make sure that only one person is sending in the answers. I'm sure all of you are communicating with each other on your own devices, so just make sure one of you guys only pounds. Okay, so I think we are clear with the rules. So team 6, team F, are you guys here?
Yeah.
Okay, so how this round is going to work is, yeah, you can see a wheel sort of thing over here. So I will start spinning the wheel, and then you will have to tell me when to stop it, and I will stop it, and then on whichever system the wheel is going to stop, you will get a question from that system. You got it?
Yeah.
Okay, so I'm spinning the wheel now. Just tell me when to stop it.
Stop.
Okay, so the question is from GIT. So moving on to the question. Okay, so X is an island in the southern Aegean Sea, about 200 kilometers southeast of Greece's mainland. A popular tourist destination, it is a sought-after location for shooting Indian film songs. As you can see, so here we have two pictures from that. I'll finish reading the question. The island is also famous for the X Film Festival, which is held annually at the open air theater, which is there in that island since 2018.
We can't answer.
No, don't answer right now. Making it very clear yet again. Only after I say pounds closed will anyone answer. Okay, and then only after I say pounds open will I have pounces. I don't want people to send in pounces before that. I am just clarifying myself again. In this round, if anyone sent it, it's okay. Neha, did you get any responses yet?
No, I didn't get anything.
Okay, so only after I say pounds open, you guys send in responses, and after I say pounds close, no more responses will be allowed. Yeah, just making that very clear. Okay, so the island shares its name with a famous Italian anatomist whose name has been used as an eponym for multiple structures in the human body, the most prominent being a duct. So identify X or the duct. It's the same answer. So it's an island in the southern Aegean Sea. If you're familiar with tourist destinations and familiar with Greece, then you might know this place. And you can see here, this is Jayam Ravi and Hansika in a Tamil movie, and then here Kritik Roshan and Katrina Kaif in a Hindi movie. So yeah, a lot of Indian movies have been shot here. Very, very popular location. I'm sure you guys have heard of this location also. And every year, film festival takes place over there for the past 2 or 3 years, and it's actually pretty popular. And this island also shares its name with a famous Italian anatomist, and who the same name has been used as an eponym for multiple structures in the human body, and the most prominent of which is a duct. So identify X or the duct. So, and then please remember that the topic of this question is GIT. So you guys might be able to get the answer. I'm opening pounds now for about 25 seconds. just look at the clues carefully. Do note that it's a GIT question. Most prominent being a duct. It's named after an Italian anatomist / island. So just think on those lines and you guys might be able to get the answer. Very popular destination. Sure, some of you might have heard of this place, definitely. So just correlate it with what we are talking about here. So I think I've given enough time for pouncing. So closing pounce in 5, 4, 3, 2, and 1. So pounce is closed, and it will be Team F's direct. Team F, do you have a guess?
Yeah, Santorini.
Yeah.
So duct of Santorini.
Yeah, duct of Santorini is absolutely right. So this is Santorini, or the duct of Santorini, which is like the accessory pancreatic duct, and that is a Santorini island, very popular tourist destination. And also the Santorini Film Festival is something which is really popular. Neha, have any teams bounced?
Yeah, team A, B, D, and E pounced and they got it right. +10.
Okay, fine. So team F, since they answered this question on the direct, they'll be getting +15, and team A, B, D, E will be getting +10. Okay, that's great. So coming back to the wheel, team E, are you guys here?
Yes, yeah.
Okay, I'll be spinning the wheel. Just tell me when to stop it. Yeah, cool.
Stop.
Okay, we'll go again. Sorry.
Stop.
Okay, that shows CVS on my screen. So I'll be going ahead with the question for CVS. Okay, so X is a condition named after two Valencian cardiologists who first described the disorder in 1990s, but then it was later found the disease is more common in people of Asian descent. Local names vary. In the Philippines, the condition has been known as bangungut, meaning a scream followed by sudden death during sleep. And in Japan, it was known as pokuri, which translates to pop off, related to a prayer for a peaceful death while sleeping. The drug DASH is commonly used to diagnose individuals suffering from X, as they are more susceptible to the arrhythmogenic effects of the drug. This feature can be observed on an electrocardiogram as an ST elevation. Identify X. Okay, so the clues in this question are, you can see two Valencian cardiologists, and then a disease is more common in people of ancient descent. But what I want you guys to look at is in Philippines, it was, the Bangangut is this character which is shown in this picture, the mythological character, belief in Philippines, a scream followed by sudden death during sleep. That is very important. And in Japan also, it was addressed by a similar terminology, where it was related to a prayer for a peaceful death while sleeping. And the second part is also there. I will be explaining the point scheme pretty soon. So this drug DASH is commonly used to diagnose individuals who are suffering from this condition, and they're more susceptible to the arrhythmogenic effects. And this feature can be observed as an ST elevation. Okay, I'll be opening pounce now, but I'll just tell you guys how to pounce. So you guys can pounce for X, that is the condition, and you guys that will give you 10 points. And you guys can also pounce for this this drug DASH, what drug it might be. So pouncing this right will give you 10 points, but pouncing the drug right will give you another 5 points. But if either of them are wrong, if even one answer is wrong, then it will be no positive points will be given, and it will just be a straight -5. So what you can do is, maybe you can just guess X alone, and then you can get a +10. If you're not sure of the second part, then you needn't pounce it. You can you'll be left with just +10. But if you're sure of the second part also, then you can pause it, you get +15. But if either of these answers are wrong, then it will be a -5. They will be, even if the first answer is right, second answer is wrong, then there won't be any positive points. It will be a -5. So you can open Pounce. I think I've opened Pounce is open, so you guys can start sending in your answers. I'll give you guys about 30 seconds. Also note that if it's your direct, don't pounce on your own direct because direct question is of more weightage, and obviously you won't have the risk of running a negative. So don't pounce on your own direct. That is also there. If you guys have any doubt about the quiz at any point regarding the pounds and all that, just stop me in the middle and then just clarify your doubts. Yeah. Just give you guys some time to discuss it with your teammates. Known as Bangangut. Okay, 1 second. I think. Okay, so one of the volunteers over here is just asking me to prompt the contestants not to use Google. So all of you are being monitored. All of you are keeping your cameras on, and all of the organizers are watching you. So if you guys are trying any unfair means or any malpractice, then it is being monitored. And I've just got a message from one of the organizers saying that it's been he did notice something was amiss. So we do not want you guys to repeat it. If we again see someone indulging in any type of malpractice, then we'll have to do something about it. But again, sincerely from my side, from a quizmaster side, please do not Google. And I'll be closing pounds in 5, 4, 3, 2, 1. Question. The pounds is closed. Team E, you're direct. Do you have a guess?
Is it Brugada syndrome?
Okay, and the second part?
I don't know. I just know the disease. Maybe Brugada syndrome has an ancient descent and CVS.
Okay, fine. Okay, I can give you points for Brugada syndrome. Brugada syndrome is absolutely right. But then I will just be Neha. Just let which are the teams which are pounced?
Team A and Team F bounced.
Or Team A and Team F pounced. Okay, have they pounced both the parts?
Yeah. Yeah.
Oh, okay, fine. So I can't give them a turn on the pass for that. So Team D, do you have a guess for the second part of the question? Team D?
Quinidine?
Passing to Team C.
The drug, right?
Yeah.
So guess indomethacin.
Passing to Team B. Team B, do you have a guess?
Isopeniline.
Okay. Since Team A and Team F have already pounced, we will not be going to them on the pass. So the answer I was looking for is Brugada syndrome. Team E got it right. And the second part is a drug which is known as ajmaline, which is commonly used in the diagnosis of Brugada syndrome, and it shows up as an ST elevation on the electrocardiogram. And you can see you can see this is Bangangut. It is a common belief in Philippines. As you can see, there is this mythological creature which is almost choking the the person to death. And like this, as you all know, Brugada syndrome is like it's a part of just sudden nocturnal cardiac death. It's one of the common reasons, and it has a very important historical connect. Neha, did the teams pounce the correct answer?
So Team F pounced it right, both the syndrome and the drug. So they get 15, and Team A got it wrong, so they get -5.
Okay, so that will be -5 for Team A. Plus, yeah.
I had sent bretylium as the drug. I think bretylium is also used for diagnosis of ajmaline is used, but bretylium also is used, I think, for diagnosis of Brugada.
And so we also pounced the part 1 as correct. So technically, if you take it as wrong, we shouldn't be getting a negative. one
No,
part
but
to
I
question
made it
is-
very clear that if either one of the parts are wrong, then you will be getting a negative. I think I made that
I
very
answered
clear.
because there is a Bertillon challenge test for Brugada, so that's why I said Ajmalin is used, but
Okay, I'm not really. I think Venkatesh was trying to say something.
I'm asking, like, is it used currently, Bertillon?
it is used. I've read, so that is why I answered. I don't know.
Okay.
Does it cause ST elevation on ECG because we are very specific with the?
Yeah, because we
Yes,
also.
it does cause.
Get you at the end of the round.
Okay, I think we can check that at the end of the round. So, okay, Neha, just make a note of this guess. We'll just clarify it at the end of the round. Just don't give them negatives yet. Like, just write it down. This is team A, is it?
Team A.
Yeah, just make a note of their answers, and then we'll just don't give them a negative yet. So scorers, just note team E will get a plus 15 for answering Brugada syndrome on their direct, and team F will get plus 15 because they answered Brugada syndrome and Ajmalin on the pounds. So team E and team F score points in this round. So moving on to team D. Team D, are you guys here?
Yeah.
Just 1 minute. Sorry. Like, do we get plus 10 or plus 15?
Plus 15 for team F. Plus 15 because you answered Brugada and Ajmalin. Ajmalin gives you a bonus 5 points. So plus 15 to team F.
Thank
And
you.
plus 15 to team E for getting it on the direct. Okay, team D, are you guys here? D for Delhi.
But can I just clarify something?
Sorry?
I'd just like to clarify something. It's team B.
Team B, yeah?
Yeah.
Okay.
For the pounds, was it plus? What was the scoring for the pounds?
It's usually, it'll be, pounds is going to be there for the next round also. It's usually plus 10, but because this question had a second part, I added an extra plus 5 for the second part. Yeah, that's it. But then usually it's going to be plus 10 minus 5 will be the points for the pounds usually. Only a couple of questions
We
will
have
have
another
this
questions
pattern.
like this, yeah.
Yeah, another question with a similar pattern. Yeah.
So I have one question. Like, suppose there are two parts in a question, and we
Okay.
could answer in our direct. We could answer only the first or the second part correct. Then how much points do we get?
Sorry, I didn't get that. Can you come again?
Yeah, like suppose, like I'm giving an example of the previous question. There were two parts to the question.
Yeah.
So suppose I answered only one part as correct. Then how much points do I
You will
get?
get plus 10. You will get plus 10. Yeah. So I made it very clear that if you're not sure of any answer on the pounds, I was like, if you get the first answer right and the second answer wrong, you still won't get any positive marks, and you will get a minus 5. I think I
So
made that
if it
clear.
was
Yeah.
my direct, then
If it is your direct, then you would have got plus 15, and plus 5, you would have got a plus 20.
okay. Thank you.
Yeah. Okay. Okay. Team D, are you guys here?
Yep.
Okay. I'm spinning the wheel now. Just let me know when to stop it. Yeah.
Stop.
Okay. So this question will be from CNS over to Venkatesh. Hello? Venkatesh, can you hear me?
Sorry, I muted myself. Okay, so the use of X as a therapy goes back to at least Greek and Roman times when people soaked in alkali-rich mineral springs to soothe melancholia. In the 1800s, it was also thought to cure gout. X gets its name from dash, a Greek word, which is because it was found abundantly in granite. So the X was found abundantly in granite. X was also an important component of a popular American soft drink, the drink, which was originally a patent medicine marketed as a cure for hangovers. But the component was later removed due to obvious side effects. So I want you to tell me what is X. So what am I talking about? So the clues over here are it's used to soothe melancholia and note the CNS question. And it was also thought to cure gout in the 1800s. And it gets its name from a Greek word, which is because it was found abundantly in granite. And this one, if you're aware of this fact, then this will also be a clue for you guys. It's found in a popular American soft drink, and it was marketed as a cure for hangovers. But then later studies revealed that due to side effects, they removed it from that soft drink. So I want you to tell me what is X. What am I talking about? So I'm opening pounds now. I'll be giving you 30 seconds. This is team D's direct, right?
Yeah, this is team D's direct. Yeah.
We'll be closing pounds in 5, 4, 3, 2, and 1. Pounds is closed. Neha, can you tell me what teams bounced?
Only team B pounced, but team E pounced after the pounds closed.
That's fine. It's before 5 seconds, right?
I mean, yeah.
Team B for Bengal.
Excuse me.
Team F also pounced.
Just a second. Excuse me.
Team B, E, and F. Yeah.
I actually pounced it. It was buffering. BSNL connection. It's
it's fine. It's fine.
Yeah, fine. Thanks.
Okay, so this is Team D's direct question. Do you have an answer, Team D?
Yeah, we do. Is it lithium? The American soft drink being 7-Up?
Yeah. So Neha, what are the answers for what did Team B, E, and F give?
They got it right. They gave lithium.
Got it right. Okay, yeah. So lithium is the answer. Yeah, so it was found in 7-Up, and the name 7-Up is because lithium's atomic weight is 7, so that's why the name 7-Up came. And then later it was removed from 7-Up because it was found to have side effects. Okay, so, Giri, can you explain?
Yeah. Neha, just tell me which teams got it right on the pounds.
Team B, E, and F.
B, E, and F.
B for ball, B, E, and F.
Okay, so team B, that is B for ball, E and F get +10, and team D answered it right on the direct, so they get a +15. Scorers, please make note. Thank you. And we are going back to the. Okay, just give me a second.
This is Team D. Could you possibly wait for 5 minutes? 2 minutes. I need to get my charger.
Yeah, sure. No issues. No issues. Just give me a second. Can you guys see my screen now? Hello?
Yes, visible.
Just a minute. I just lost connection with my partner on the phone. I'll just call her back. Just a minute.
Yeah, okay. No problem. Just let us know when you're back.
Yeah, we are ready.
Okay, so I think we are done with 3 questions. So this will make it Team C's direct. Team C's turn to spin the wheel. Team C, are you ready?
Yes.
Okay. So spinning the wheel now. Just let me know when to stop it.
Stop.
Okay, you'll have to go again. Yeah.
Stop.
Okay, so this question is from Renal.
Why is it still moving?
I think there might be a bit of a lag. There might be a bit of a buffer in it. Okay, going into the question. Can you mute yourself? Excuse me.
Sorry.
Yeah, no issues. So X is a medical condition that mainly affects people living in rural areas of Romania, Bulgaria, Croatia, and Serbia. There is a map which is there in the next slide. So originally described in the late 1950s, the disease is characterized by its unique epidemiological features. The disease can be attributed to the ingestion of seeds of a particular plant dash, which was found to intermingle with the wheat grain used for making bread. Hence, only individuals living under the same roof and eating the same food were affected. The patients are distinguished from those suffering from other causes of ESRD by showing a long incubation period, an absence of high blood pressure, xanthochromia of palms and soles, early hypochromic anemia, absence of proteinuria, and slow progression of kidney failure. Identify X or name the disease. Okay, so in this question, a lot of clinical findings are there in the latter part of the question. But the first part of the question, you can say that it's a medical condition, people living in rural areas of Romania, Bulgaria, Croatia, and Serbia. And it has a unique epidemiological features. And the disease can be attributed to the ingestion of seeds of a particular plant dash, which was found to intermingle with the wheat grain used for making bread. Hence, people who are living under the same roof and eating the same food, because they tend to share food, they also ended up getting the disease. And then this disease was more prevalent in those regions which I have described before. So this next slide might help you. So like you can see this region over here. The countries are there, so I don't really need to highlight which part of the world this is. And you can see how like in places where most number of cases are observed are marked in are marked in yellow. So that may give you a clue about what this disease might be. I'll be opening Pounds right now. Before I open Pounds, okay, sorry, okay, Pounds is open. I'll just explain this. Similar to the Brugada question, also have one more blank which needs to be filled out, something like a bonus blank. So you can pounce for X, and then you can also pounce for the bonus part. But then if either of it is wrong, then you won't get any additional points. You will get a straight negative. But if at least one of the parts is like if you get the first part right, then you'll get a plus 10. If you get the first and the second part right, you get a plus 15 on the Pounds. This is on the Pounds. And if again this it's going to be in a similar pattern, and if either of the answers are wrong, then it'll be a -5. No positives, it'll be a -5. So be careful when you're pouncing. If you're sure only of one part, then just pounce that part alone, and you'll be getting the points accordingly. This is Team C's direct. Just wait till Pounce is closed. Be giving you guys another 25 seconds or so to discuss it with your teammates. Giving you guys a few more seconds before I close Pounce, and I will be closing Pounce in 5, 4, 3, 2, and 1. Pounce is closed. This will be Team C's direct. Team C, do you have a guess? Team C?
Low syndrome. No, sorry. Yeah, Low syndrome. LOWE. Low syndrome.
Okay. Do you have any guess for the second part?
No.
Okay, fine. Neha, can you tell me which teams have bounced?
Only team E bounced.
Oh, okay, fine. So we'll be going from team C to team B. Team B, do you have a guess? Team B, B for Bombay.
Hashim-Beck's disease.
Sorry?
Hashim-Beck's disease.
Okay, and the second part, do you want to take a guess?
We don't have a clue about that.
Oh, okay, fine. No problem. Team A?
Pass, sir.
Oh, okay, cool. Team F?
Pass.
Okay. Team E has answered on the pounds. So Team D?
Would guess letharism with seeds of Synthetic sativa.
Sorry?
Letharism, seeds of
Oh,
letharism.
sorry, I couldn't hear that. Laterism. Okay, from Lateris sativus. No, that will not be the answer we are going for. So I think, Neha, did any teams get it right on the pounds? Okay, sorry, let me tell the answer first. So the answer we were looking for is Balkan endemic nephropathy. So as you can see, also known as Danubian nephropathy. So you can see the Danube River, and this is the Balkan region. And then like you can see that this disease was endemic to these regions, like along the river coast, and where people were harvesting their wheat fields, and this plant called Aristolochia, which is also known as a European birthwort. These seeds were, they were like weeds which are growing within the wheat fields, where they used to harvest the wheat grain to make bread. So ultimately the bread ended up having these aristolochic seed, which contained aristolochic acid. This aristolochic acid led to these characteristic end-stage renal disease symptoms, which was termed as Balkan nephropathy. Neha, did I think one team pounced? Did they get it right?
Team E, yeah, they got it right. They got both the answers right.
Oh, okay, amazing. So since they got both parts right, plus 10 for Balkan nephropathy and plus 5 for aristolochic acid, Team E will be getting 15 points. So that was Balkan endemic nephropathy. So going back to the main slide. So Team B, are you guys ready?
Yeah, we're ready.
Okay, cool. I'll just be spinning the wheel. Just let me know when to stop it.
Stop.
Okay, so this question is from Lung. Venkatesh will take over.
The question is X located in the small airways were formerly known as Y. So they are low columnar cuboidal cells that possess secretory granules. They are also involved in the process of degrading toxins. So Y was an active member of the Nazi Party and used tissue taken from executed victims of the Third Reich for his research, including the work that led to his discovery of Y. A few years ago, the editorial boards of most of the major respiratory journals concluded that the continued use of Y's eponym would be equivalent to honoring him. They therefore introduced a name change policy, after which Y and Y secretory protein were conclusively replaced with X and X secretory protein respectively. So I wanted to give me X and Y. So only if you give me both the answers, you'll get the points. So the clues over here are they are located in the small airways and it's from lung. Then they are low columnar cuboidal cells. They possess secretory granules. And then there was a name change wherein Y was changed to X because Y was associated with the Nazi party. So they found it like it would be honoring him. And yeah, Nazis, they thought they shouldn't honor him. So then they changed it to X. So I wanted to give me both X and Y. So pounds, I'm opening pounds.
Venkatesh,
I'm
did
going
you
to close
mention?
pounds.
Yeah, okay, close
Yeah.
pounds. Okay, fine. Okay, cool.
Yeah, I'm closing pounds in 5, 4, 3, 2, and 1. Pounds is closed. Neha, can you tell me what teams bounced?
Team C and Team F only bounced.
Okay, so this is B's direct question. Do you have an answer, Team B?
Okay, type 2 pneumocytes. For X.
Is it? Okay, X is type 2 pneumocytes. What's Y?
By Mengele.
Sorry?
Mengele.
I can't get you, sorry.
Joseph Mengele.
I can't get you, I'm sorry. Process Mengele. Hello, can you repeat?
Mengele.
Okay, the Nazi guy is saying.
He's saying Joseph Mengele.
Oh,
He's saying Joseph Mengele. Yeah.
Oh, okay, okay. Okay, so I'm going to, the question is going to pass to Team A. Team A, do you have an answer?
Kilchutsky cells, and now it is enterochromaffin-like cells.
Okay, I'm going to pass it to Team B. No, sorry, Team E. Team E, do you have an answer?
Is it Clara cells and later to clear cells?
Sorry, what is Clara cells and what is clear cells?
Yeah, both are the same. Clara cells, it was that was the first name, and later it was renamed to clear cells.
Okay. Okay, so Giri?
Have we finished with all the teams?
No, your Team E, right?
Yes, yeah.
Team E. So Team D is left. Team D, you have an answer?
S would be Clara cells and pneumocyte Y is Clara and X is pneumocyte secretory protein.
Y is what? Sorry, come again.
Clara cells.
Okay, Y is Clara cells. X. Y is Clara cells. Pneumocytes? Just pneumocytes. Okay. So Neha, can you tell me if they're correct?
Team C got it wrong. Team F got it right.
Team F got right. Giri, can you go to the answer slide?
Yeah, okay. 1 second. Yeah.
So the answer is X is club cells and Y is Clara cells. And Team E got it right, if I'm not wrong. Team E and Team D. They got only Y, right?
Yeah, they got only one part of the question.
So
Team E
I
got
can't
it
give
right.
marks. I can't give marks to Team B.
Yeah, because Team E got it right first. I was expecting if Team D had given me the answer of club cells, then probably we could have given them 5 more points. But then since Team E just got Clara cells right, and but then the answer for X which you're looking for is club cells but not clear cells, I think we can give Team E 5 points, right?
Yeah. Okay. Fine.
Okay.
And on the pounds team, which team answered correctly, Neha?
Team F will get +10 and Team C is -5.
Team F is +10 and Team C is -5.
Okay.
Scorers, please make a note.
Okay, so going back to the main slide, I think we have only one team left to spin the wheel. I think it's Team A.
Okay.
Team A, are you guys here?
Yes.
Okay, so I'll just same routine. I'll just spin the wheel and you guys let me know when to stop it. Okay.
Yes.
Only skin is left, right?
Okay, I don't.
Stop.
Oh, okay, I'm so sorry. Only skin is left. I didn't notice that. So yeah. Anyway, you will be going ahead with skin. Yeah. So yeah, I'm sorry. I didn't notice that. I'm really sorry. So moving on with skin, Venkatesh, over to you.
Yeah. So X is a medical condition, the external appearance of which can be likened to the skin of humans who are inhabitants of the planet Naboo. This is a reference from Star Wars, episode 1, to be specific. So the infectious disease is characterized by polycyclic or serpiginous scaly plaques that occur superficially on the skin. The condition is common in several humid tropical regions, especially in the parts of Polynesia and Melanesia. So I want you to name the medical condition what I'm talking about, which is X. So the clues over here are it's an infectious disease and it consists of scaly plaques, which occurs superficially, and it's a skin condition. So this is a close-up picture of the skin of Gungans, who are these people shown here. So the lesions look somewhat like this. So yeah, so I'm going to open pounds. I'm opening pounds here. And they are found in parts of Polynesia, Melanesia. So there's some endemicity to the disease. It's an infectious disease. So I'll be closing pounds. 5, 4, 3, 2, 1. Pounds closed. Neha, can you tell me what teams pounced?
No one pounced.
So it's Team A's direct. Do you have an answer, Team A?
I'm guessing Tinea.
I want to be more specific.
Tinea, it's not the corporis hand body. Tinea.
Okay, so what's your answer?
Manum, I don't know.
Okay, the question passes Team F. Team F.
Erythema annulare. I'm not sure.
Okay, passes to Team E.
Yes, is it Tinea imbricata, polycyclic scaly plaque?
Okay, Team D.
Is it dermatitis herpetiformis?
Venkatesh, did you listen to Team E's? I think.
Team E answered.
Okay, fine.
I'm just passing the question.
Okay, cool.
So Team C.
Cutaneous larva migrans.
Team B.
No idea.
Sorry?
No idea.
No idea. Okay, so Team E answer is correct. The answer is Tinea imbricata, which is most specifically seen in Polynesian, Melanesian regions. It's a superficial fungal infection. So yeah, the answer is Tinea imbricata. But Team A said Tinea, but I want it to be more specific because there are many species of Tinea and it causes. So I want it to be more specific. So I'm giving points to Team E.
No one pounced on this question, right?
Yeah, no one pounced.
Okay, so Team E will be getting plus 10 on the pass for this question. Okay, so I think we are done with this round. I think all the teams got a direct from this round, and so we'll be moving on to the scores. So, okay, I think we did have a little bit of an issue with one of the answers of Team A. We are still keeping that on hold for now. We will look into it. But just without that part of it, can we just have a look at the scores? Namrata, are you there?
Yeah.
Okay.
Excuse me. How was what did the last question have to do with Naboo?
So their skin resembled the disease. That's what we were going for. Like their skin resembled the skin of Naboos resembled the disease condition. Because even their skin, the close-up of their skin was shown over that. So their skin is similar to the disease. Even they have scaly plaques, which is circular, and some serpiginous. So they are assemble Tina and Deepak together.
Okay, so the marks after the first round. Team A 20, Team B 50, Team C 50, Team D 25, Team E 95, Team F 80.
Okay, fine.
Excuse
So, yeah. So,
can
sorry.
you just add it up? That's 40 plus 30 plus 30 plus 5. So that's 105.
1 second. So
It's 40.
45. Yeah, wait.
Okay, just add it up as well.
Wait, from how I look at it, I think it's 30 and 15. So that's 45, 85. And yeah, okay, that should be
F
105.
also, we have 85 points. It's been added wrong.
Okay, fine. Yeah, okay, cool. We got that sorted. Team A, we will get back to you with that. For now, we are not considering the negative, but then we will get back to you with that question. The organizing team did look into the answer which you have given, but then they really couldn't find substantial evidence to that answer. So it would be great if you guys can just give us the source for your answer. Just tell us from where you got the answer, and we'll be happy to give you the points. Team A, are you guys there?
Okay.
You studied it from somewhere, right?
Yes, I did.
Yeah,
Yes, I did.
just give us the reference from where you've given your answer, and then we'll be happy to look into it.
I have to search it then.
And I think we've been quizzing for quite a while now. I think it's been 3 hours plus, and then all the teams have been super enthusiastic, and then we've been getting some amazing answers, and team. And right now, I could say it's a very tight competition between Team E and Team F. There is a difference of 20 points, and then in the next 2 rounds, there are a lot of points up for grabs. Even Team A and Team D, you also can make a comeback, and if you can get a lot of points from the next 2 rounds, then you have a chance of finishing in the top 2 as well. And then Team B and Team C are also there in the running, obviously. So we are in for another exciting 2 rounds. And then on that note, I think we can take a 5 minutes break now, because we've been 3 rounds must have been exhausting for all the participants, and I think a break would be fine. So I think I think we can break for 5 minutes now. Is that
Yes,
good,
yes.
Garimadi?
Yeah, sure.
Okay, fine. Okay, so yeah, you guys just get something to eat if you guys are hungry, and just take a walk if you've been sitting for too long. So we'll be back in another 5 to 10 minutes, and then we can get started with the next 2 rounds.
We are not disconnecting, while you go on a break.
Sorry.
We are not disconnecting, right? We'll still remain
Yeah.
connected.
You can stay on the call.
Turn off your videos.
Yeah, just turn off your videos, just turn off your mics, and then we'll be back in another 5 to 10 minutes. So I think the time right now on my clock it's 9:08. Okay, 9:10. So say by 9:20, shall we meet back? Shall we meet again?
Yeah, cool.
Okay, fantastic. Okay, so yeah, it's been great quizzing with you guys for these first 3 rounds. Thank you so much for your participation, and we'll be seeing each other. We'll be seeing you guys again at 9:20. Okay, thank you guys.
I hope everyone is enjoying this quiz. I would like this moment to thank our sponsors. So, PLA Remedies, thank you so much for being a part of this quiz. Then we have our next sponsor, Dr. Bhatia, Medical Coaching Institute. Thank you so much for sponsoring and sponsoring the prize money for the winners, sponsoring the prize for the winners. Then Kasen Pharma and Athulya Assisted Living, thank you so much for being a part and helping us in the better cause. Thank you so much. I hope everyone is here now. Can everyone please switch on their videos? Everyone please switch on their videos. Give a thumbs up if you all are here. Everyone is requested to switch on their videos now. Please give a thumbs up if you are here. Team F Alicia, Rinjim.
Yeah, we're here.
Yeah. Can you please switch on your videos too? Yes, Neha, Venkateshwaran, Devamsh, everyone. Dr. Anujit, please switch on your videos. I would like to capture this moment with you all. So, everyone, please smile or make a victory sign or whatever you like, however you want to be captured. Hope you all are having fun. I can't hear any one of you.
Any one of you wants to say anything that you're enjoying?
Okay, I think is there anyone else to join? Okay, Devamsh is joining.
Yeah. Dr. Anujit, if you are here, please switch
Dr.
on your
Anujit,
video.
Devashishda, Giri,
Giri.
Giri is not here, I guess.
Giri. So we can wait for a minute.
Hello, guys, can you hear me?
Yes,
yes.
Yeah, switch on your camera.
We are capturing
Just
this moment.
can you guys just give me another second? I'm just getting my charge.
Yeah, sure.
Yeah.
Sure.
Let me know when Giri you are back.
Yeah.
I think everyone is
Sorry,
here.
guys. Had a small problem with my charger. I think it's sorted now. Yeah. So.
Is everyone here?
Yes, I think everyone is here. Team B, could you please show your face?
Prithvish.
Yeah. I think everyone's visible. Team D, Sujaya also. Yeah, perfect. So we are good to go. Pose whatever, however you like. Yeah, perfect. I think we are good to continue with the quiz. Over to Giri and Venkateshwaran.
Okay. Fantastic. So yeah, just checking one last time. Is everyone back?
Just give a thumbs up.
Yeah, just send a thumbs up on the everyone chat box, and I think we'll be good to go.
Or a why?
Okay, cool. I think I'm seeing. Yeah, I think I'm seeing most of the teams are sending a thumbs up on the everyone chat. So I think we can go ahead and proceed with the remaining 2 rounds of the quiz. Before that, can we just have a look at the scores again, so that we know where each team stands?
Amrita, can you just show the screen once?
Yes. Can you guys see the screen?
Yes, we can.
Yeah. Okay. Okay. Team A, regarding the regarding that small discrepancy we had, do you have any?
Yes, I actually can't recall. I can't recall actually at the moment. It's fine.
Okay, but then I think we will have to give you the -5 because we have to go according to the rules of the quiz, and because we clearly mentioned that if you could give us a reference, then I mean we could have given you the I think we could have given you the full points, but then isn't there any reference you couldn't find, like on the internet or anywhere, anything you could find?
No, I read it in some book, so I can't recall. So internet I didn't search. No, it's okay.
Okay, fine. I'm sorry because I'm not familiar with which book you read it from. I also did some. We did have a bit of a break. I did some reading, and then I also did go and check up on a few things. But I also couldn't find that particular answer. Otherwise, we would have been giving it to you. But unfortunately, we just have to go by the rules. So we have to give you a -5. So I think we are running a little. I think we were supposed to finish much earlier, but then it just got delayed a bit. We'll just make sure that we get done with these last 2 rounds as soon as possible, so that all of us can go ahead and I'm sure there are a lot of early birds here who go to bed early. So we won't be keeping you here for too long. So with that, we will go into the next round. I think that issue with Team A has been sorted. I think Team E is in the lead with 105 points. Team F is in second place with 85 points. We had 2 teams on 50 points. I think that was Team B and Team C. So that's great. And then the other 2 teams also have 2 more rounds to catch up. Fantastic. Okay, so moving on to the next round of the finals, which is the 4th round. Okay, the 4th round is going to be a little different. I will talk about the rules just in a bit. Okay, so the 4th round of the DFC finals, we are going to be calling it Unravel. So again, 6 questions, similar to all the other rounds. We are going to be having six questions, and each team gets to choose a question. I will explain in a bit how this is going to work. So that question will be that team's direct as usual, and then other teams can answer a bounce or pounce. This is a similar pattern which we've been following in the spin the wheel round. Pounce also, if there's any part points, all that I will notify you guys much in advance, and then again you have a similar pass. So all the point scheme also will be same, plus 10 minus 5 on pounds, plus 15 direct, and plus 10 pass. Yeah, no changes about that. Okay, so the thing is, why we are calling this round unravel is that there's going to be a large picture on the main slide. So, and then we'll also be giving you guys points for guessing the overall picture. I think if I go to the next slide, you guys will get an idea. Okay, so this is how this round is going to look. So as you can see on the sides and on the top, you can see question 1, 2, 3, 4, 5, and 6. We have just ordered it in that number. So once we are done with question 1, we'll be done with question 1, like how in the previous round, we'll have a direct, we'll have a pounce, we'll have a bounce, similar rules, no changes in the rules, no changes in the points, absolutely nothing. Any changes will be notified by the quiz masters. And once we are done with question 1, the box which is there next to question 1 will be uncovered. So when I click on it, a part of the bigger picture will be revealed over there. And at this point, teams can try guessing what the overall picture might be. And I will notify this when we finish the question, and when we come back to the main slide, I will tell you guys what will be the point scheme for each box and all that. So let's say, for example, one team is selecting question 1, and then I reveal that particular box, and then you can see part of the picture. When you see part of the picture and you want to go for the overall, 1 second, I think I'm getting message in the chat box. 1 second. Yeah, okay, we got that sorted. Yeah, no issues. Okay, so once we finish question 1 and then we reveal a part of the overall picture, then the teams can get a chance to answer the overall picture if they have an idea. So what we will be doing here is, once I finish question 1, once I reveal the box, I will say, okay, now I'll say pounce open again, because it's going to be like a pouncing sort of thing, right? So I will just say pounce open, and then you guys can try guessing for the overall picture. But because you will be pouncing, there will be a negative for this. So they will be when I reveal the first box, it'll be a plus 30 minus 15, and similarly if 2 boxes are revealed, it'll be plus 25 minus 12.5. Similarly in that pattern, we'll be going plus 20, plus 15, plus 10, and plus 5. And once the whole picture is revealed, we won't be giving you any negatives. You can guess for 5 points as such. So that will be the theme of this round. Be very careful when you're guessing for the overall picture, because there are negatives. So once I finish question 1, I come back to the slide, I reveal a box, and then I tell you guys, okay, pounce open, you guys can try guessing for the overall picture. Be a plus 30, but if you get it wrong, it will be a minus 15. So be very careful when you go for the overall guess. And once I'm done with question 4, once we've done with all the direct bounce pass, they again come back to the main slide, and then we'll reveal the box again, and then the procedure goes so on and so forth. One more thing which I wanted to tell is, if you pounced once, let's say you pounced when the first box is revealed and you're wrong, which means you get a minus 15. You can pounce again when we come back to this main slide, and when 2 boxes are revealed and you think, oh fine, okay fine, this might have been this should have been the answer, or so something like that, should have been the answer or something like that, then you can again pounce again and probably make up for the negative which you got. Now, does any team have any doubts about how this round is going to work? Please ask me right now.
Yes.
Yeah, tell me.
So the pounce is only for the end picture, right, and not for the individual questions.
The pounce will be there for the individual questions also.
So what is the marking for that?
That will be same marking only, plus 15. Plus 10 minus 5 for the pounce, plus 15 on the direct, plus 10 on the pass.
And is that like the individual? Are those individual questions going to get passed if the team fails to answer?
I don't understand.
Assume the teams fail. Whoever the direct question is, if they fail to answer, do those individual questions pass?
Yeah. Individual questions. So individual questions are just going to work like how it worked in Spin the Wheel, and then the overall picture will be a separate pounce altogether. I'll be notifying the points for those pounds also as and when the picture is revealed. And note that the picture, just by looking at a part of it, don't try to go for the overall one, because the overall one might be something different. So only if you are very sure of what the overall one might be, go for it. Otherwise, you guys wait for maybe more boxes to be revealed, and probably the answer will be more clear to you. Any more questions on this round?
So for the bigger picture question, like all 6 boxes are related.
It's one picture. The background picture is one picture. I've divided it into 6 boxes. So if I reveal one box, a part of that bigger picture will be revealed, and you can try guessing what the overall picture might be. I'm not telling you guys what the overall picture will be. Once I reveal one box, you guys will see it for yourself. Yeah.
Negative marking in that if it's wrong. So
yeah. So
be careful. Don't go for it.
Yeah, don't go for it. Only if you're very sure of it, then you can go for it. Okay. So since we did the first two rounds.
Also, sorry, one last thing.
Sure.
How much do you lose on a normal pound? It's -5 only still, right?
On each question, the normal pounds you lose -5 only. Only on the bigger question, bigger picture, the pounds for that.
-15 to 0 on -2.5s, right?
Yeah. Correct. Yeah. True. Okay, so since we did the first 2 rounds in a clockwise pattern, the second 2 rounds we'll be doing an anti-clockwise pattern. So even this round we'll be starting with Team F. So Team F, which question would you like to choose?
Also, I'm sorry. We sent the bigger picture question to Neha only, right?
Yeah. Bigger picture question. Yeah. The pounds. Yeah. Whatever pounds, anything related to pounds goes to pounds, Neha. Okay. Sorry. Okay. I think. Okay, fine. You can just. I hope none of you guys saw it. Finger slip my part. I'm so sorry. So yeah, but then you guys still don't know which question is that. So yeah. So Team F, please choose your question. Team F, hello. I can't hear Team F. Is it an issue from my side?
They have to unmute themselves. Team F, can you please unmute yourself?
Question 1.
Go for question 1. Okay, fine. Okay. So cafe au lait spots, which is French for coffee with milk, are hyperpigmented macules, are seen in strong association with neurofibromatosis and McCune-Albright syndrome. However, there is a slight variation in the presentation of the skin lesions in both the diseases. To help distinguishing them, they have been likened to these map drawings of the USA shown in the adjacent picture. Explain why these skin lesions have been compared to these geographical features. So I'm sure all of you know what cafe au lait spots are, and is seen in association in neurofibromatosis and McCune-Albright syndrome. However, there is a variation in the presentation of skin lesion in both the diseases. And to help distinguishing them, they have been compared to the 2 map drawings which we have shown in the site, which are places in USA. So explain why these skin lesions have been compared to these geographical features. You don't need to give me the exact name of the place or anything as such. You just have to sorry, I'm just getting you just have to give me what I'm talking about, like why I'm asking you guys what do these pictures have a correlation with what I'm saying. So pounds will be I'll open pounds now for about 30 seconds to explain to discuss the answers with your teammates. One more thing. So yeah, you'll have to explain both. Like I've talked about slight like skin lesions in 2 diseases. So if you're pouncing, complete answer is what I will take. So I think most of the teams might have got the answers. So I'll be closing pounds in a few seconds. Okay, pounds closing in 5, 4, 3, 2, and 1. Pounds is closed. This will be Team F's direct. Team F, do you have a guess? Team F? Team F, can you guys hear me?
Please unmute yourself, Team F.
Okay, so I think it's like something to do with the borders of the lesion. I think for like one of them is in Canada, the other one is in America and California. It's like the edges of the coast, I think, is likened to the lesion, like the caveolad spots.
Can you rephrase your answer? Can you give me a better answer?
The coast is like for mucune albright is irregular. It's an irregular border. For neurofibromatosis, I think it's more. It's more. It's
Okay, fine. I'll give it to you. That was the explanation which I was looking for. I think Team F gets it right. So this is the coast of Maine and the coast of California. Coast of Maine and the coast of California, which are given in the pictures, and because McCune Albright syndrome presents skin lesions with rough irregular borders, it has been likened to the coast of Maine. And neurofibromatosis, because it has because it has smooth borders, it has been likened to the coast of California. So as you can see in these pictures, you can see that coast of Maine has a really rough border, so it can be likened with McCune Albright syndrome, and a smooth border is for neurofibromatosis. So 15 points to Team F. Neha, did we have any pounces?
Yeah, Team A and Team B pounds, they got it right.
Okay, fine. So both Team A and Team B for Bombay, right?
Yeah.
Okay, so Team A and Team B get it right on the pounds, so that will be plus 10 for them. And Team F, direct question, they got it right. They got the reasoning right. Like coast of Maine, coast of California would have given them full points, but then I was just looking for the reasoning at the end of the day. So I think they get plus 15. So going back to the main picture. So since question 1 is complete, I will be revealing this part of the main picture. So now I'll just click on this. Yeah, so you can see a part of the main picture has been revealed. So now I'll be opening pounds, and you can go for the overall picture. And for this thing, it is plus 30 minus 15. So be very careful when you guess. I think by revealing the first box, you guys might have got an idea of what the background picture might be, but then be very careful when you go for the overall connect. Just give you guys some more time to see the clues which are there in that small part of the overall picture. Okay, so closing the pounds for the picture in 5, 4, 3, 2, and 1 pounds for the large picture is closed. Neha, did you get any answers?
Yeah, Team B pounced and they got it right.
Oh, okay, fine. Team B for B for ball.
Oh, yeah.
Fine. Okay, Team B has got it right.
Plus 30.
Yeah, so they get plus 30 points. Really, that's they've taken a huge risk, I guess, going for it in the first picture, and they've got it right. So plus 30 points for them. So moving on to the next team, which is since we are going anti-clockwise, we'll be going to Team E. Team E, are you guys here? Team E?
Yes, yes.
Okay, which question would you like to select?
Number 5.
5. Okay, fine. So going to question 5. Okay.
Yeah, so question 5. X is a clay mineral with the chemical formula. Yeah, you can see that. It is sometimes used as an adulterant to illegal heroin to expand volume and weight and thereby increase its street value. So basically, intravenous drug abuse of substances like powdered heroin is often associated with foreign body embolism and pulmonary microvasculature. The presence of X in the intravenous mixture can elicit a granulomatous response in pulmonary arteries. So inhalation of X can also lead to X-induced pulmonary granulomatosis. So what am I talking about? Like I want you to ID X. So what mineral is X? So the clues over here are it can cause granulomatous response. Then in the pulmonary microvasculature. So and heroin is a big clue, an adulterant. So I'm opening pounds. Closing pounds in 5, 4, 3, 2, and 1. Teamy, do you have an answer?
Yes. It is the mineral talc and its pulmonary talcosis.
Okay, okay, so I just wanted the middle. Yeah, fine. Okay. So the answer is correct. Neha, did anyone pounce?
No, no one pounds, but like Alicia, I got the answer just now.
I think
Because
it
he
is
already
like,
told the answer.
yeah, and
So
I
after
think
he told the answer, he got it.
Yeah.
Yeah.
Yeah, I
don't
think
think we can
we
give.
can't. Yeah, it's like I think it's like we said pounds closed and it's been more than 10 seconds, so I
Yeah,
think
yeah.
it can't be counted as a pound. So yeah, we can't.
So going back to the tile.
Yeah, so just moving back to the tile. So since question 5 is what Team E answered correctly, so yeah, Team E gets plus 15 points. Scorers, please note, and no one pounds, so no points for them. So I'm just revealing this tile. Okay, so I'm opening pounds for the overall picture. There's a few more clues in this. There's a few more clues in this tile. So maybe if you can just make out the clues, then it might give you an idea of the overall picture. So just look at the 2 tiles have been revealed. So just look at all the clues that are there. I mean, only parts of the words are there, but then I guess you can figure out what is actually there. So maybe based on that, yeah, the points for this will be plus 25 minus 12.5. Sorry, I didn't mention that. Will be plus 25 minus 12.5. Just giving you guys some time to discuss it with your teammates. So I'll be closing the pounds for the overall picture in 5, 4, 3, 2, and 1. Pounds is closed for the overall picture. Now moving on to Team D. Team D, are you guys here? Team D?
Yes.
Okay, which question would you guys like to select?
We'll go for question 2.
Question 2. Okay, fine. Moving on to question 2.
Should I say?
Oh yeah, sorry. Oh, so, okay, wait, I'll just go back to the main slide. Yeah, sorry, just, yeah, I'm so sorry, I forgot to ask you. What are the responses you got?
Team E and Team D bounced. Team D got it right. Team E got it right, and Team D
didn't get it right. So that will give a plus 25 to Team E and a minus 12.5 to Team D. Is that right?
Yes.
Okay, fine. Scorers, please note. So I think one of the teams have got it right, just based on 2 tiles. So that's great. And then another team, you can pounce again so that you can make up for the negative which you got, because there's when I reveal one more tile, there will be sorry, just give me a second. Yeah, so there will be 3 more. There will be 3 tiles revealed, and that will really give you a clue as to what it is. You can make up for your negative. No worries about that. And team D had also chosen question 2. So going to question 2, over to Venkatesh.
In the Unitude of the year 2009, a well-known Swiss MNC voluntarily recalled 3.6 million packages of its popular choco chip cookie batter. This action was taken following reports of people getting hospitalized from ingesting the batter raw. Usually, the batter should be ingested after making it into cookies, but then they were ingesting it raw without baking it. So the outbreak nearly affected 66 people in 28 states of the US. Nearly 25 people were hospitalized, with 7 succumbing to severe renal complications. The pathogen X responsible for causing the outbreak affects people frequently, and most recover within a week, but a select few strains of X can lead to serious kidney damage and death in a few cases. So I wanted to identify what is X. So the clues over here are it causes severe renal complications, and then most recover, but then a few can get on serious kidney damage and death. So yeah, so those are your clues. So I'm opening pounds. So it should be an organism that's heat labile. So that's why when they ate it raw, it affected the people, but while baking, it can affect. So I'm closing pounds in 5, 4, 3, 2, and 1. So pounds is closed. Neha, can you tell me who bounced?
Team A and Team E bounced.
Okay. Okay, so this is a direct question to Team C, right?
Yeah, Team C. Yeah.
Yeah. Team C, do you have an answer?
Team D.
Team D.
Oh, sorry.
Yeah, Team D. Sorry,
Sorry.
my bad. Yeah.
Sorry, my bad. Yeah. So Team D, do you have an answer?
Was this a streptococcus outbreak?
The question passes to Team C.
Staphylococcus aureus.
No, the question passes to Team B.
Is this Salmonella typhi?
The question passes to Team F.
E. coli?
Yeah, so that's the correct answer. Neha, did anyone pounce?
Team A got it right, and Team E didn't get it right. So
Going on to the tile, Kiri.
So I think Team
F got it right on
the pass. So that will be
on the
plus
pass.
10. And then Team A will get a plus 10 and Team E will get a minus 5.
They bounced.
Okay. Going back to the tile. Okay, so since we just finished question 2, we'll be revealing that box, and that does give you a clue as to what the overall picture is. And
Pounds is open.
Pounds is open for the overall picture. Yes, you can send in your guesses.
Pounds pounds is closed.
I think, yeah, I think you can.
Team C pounced and they got it wrong, so -10.
Team C.
Yeah, Team C.
Yeah, sorry, forgot to mention the point scheme. Yeah, but then I think you guys went around +20, -10. And was Team C the only team which pounced, Neha?
Yeah.
Okay, so Team C pounced and got it wrong, so that will be -10 to Team C. It's okay. You guys still can make up for the negatives, as we have 3 more tiles to be covered. And now it is your turn to choose the question as well. So Team C, which question would you guys like to choose?
Okay.
3.
Question 3. Okay. So moving on to question 3. Okay. So in this picture, you can see 3 individuals. I'm not going to name the one in black and white. As you all might know, this is Madonna. This is David Letterman. So these 3 popular individuals suffer from a condition in which an increased gap is observed between the frontal 2 incisors. And this has a particular significance in the field of radiology. So just explain. Just going back to the picture for a second, you can see that all these 3 individuals, they have a gap in their frontal 2 incisors. So this guy is sort of the guy in black and white. He's sort of important for the question as such. And but then Madonna and David. So because going back to the question, because the person in black and white has been out of trend, is probably popular like 50-60 years back. It is not reference to it. It is still reference to him, but then for current clinicians to understand, it may be reference to Madonna or John Letterman. So, but what this particular thing where there's an increased gap between the frontal 2 incisors has particular significance in the field of radiology. And it may not have anything to do with dental or anything. It might be something completely different. So be careful when you're pouncing. So I'll be opening pounce now for about 30 seconds. Team C's direct, I think, but we'll just wait for the other teams to pounce. Give another 15 seconds or so. Think that was enough time to discuss the answers. So I will be closing pounds in 5, 4, 3, 2, and 1. Pounds is closed. Team C, your direct, do you have a guess?
Is it due to deformity in fusion of the hard palate?
Not the answer I was looking for. Passing to team B. Oh, sorry. I'm sorry, Neha. Which teams bounced?
E, F, and A bounced.
E, F, and A bounced. Okay, fine. So going to team B. Yeah, team B. I can still take your guess.
He passes well.
Okay. Team A bounced. Team F bounced. Team E also bounced, Neha?
Yeah.
Okay. So coming back to team D, do you guys have a guess?
Pass.
Sorry, I didn't get you. You are passing?
Pass.
I can't. 1 second. Oh, that was pass, right?
Yeah, we're passing.
Okay, fine. So the answer which I was looking for is the Terry Thomas sign. So as you all know, Terry Thomas sign is a very famous sign in field of radiology where you have scapholunate dissociation of more than 2 millimeters, and as a result of and this was named as Terry Thomas because Terry Thomas was a very popular American comedian, and he was known for this. This condition is known as a frontal diastema. So increased gap between the frontal 2 incisors is known as a frontal diastema, and this is why it was this was likened to the likened to this radiological finding of a scaffold unit dissociation, and it was called a Terry Thomas sign. And then because Terry Thomas, not many people know his name. Mainly in the USA, it has also been called the John Letterman sign or the Madonna sign, because both of them are also known to have a frontal diastema. But more commonly, it's referred to as the Terry Thomas sign. Neha, did the teams get it right on the pounds?
Yeah, Team E and Team F got it right. Team A didn't get it right. So plus
okay.
Team E.
So Team E and Team F will get plus 10 and Team A will get minus 5. Okay, so going back to the main slide. Since we completed question 3, I'll be revealing this tile to give you further clues to as what the overall picture may be. Opening pounds right now for the overall picture. We'll keep it open for 20 seconds or so because a lot of clues are here, and I would expect you guys to send in your answers fast. So, and would also like to wind up this quiz fast. And yeah, this is the penultimate round. We'll have one more round. The last round will be, I will tell you guys what the last round is. Most of the picture is revealed, and then points will be plus 15 and minus 7.5. Yes, please note. Sorry, closing the pounds for the picture in 5, 4, 3, 2, and 1, and pounds is closed for the overall picture. Now, seeing that we are done with 4 teams, I think it is Team B's direct. Team B, which question would you like to choose?
Team Team F pounds, and they got it right.
Oh, okay, fine. So plus 15 to Team F. Score
And A.
And Team A also. I think Team A had got a negative initially, if I'm right. I'm not sure.
Yes. Minus 5 we got.
Oh, yeah. So yeah, you guys just made it up. Fantastic. So plus 15 to Team A and Team F. For the other teams who still haven't, which teams haven't yet gotten it, Neha? The overall picture?
1 second.
Yeah, I think Team A, Team F got it now. Team E got it.
D didn't get it. C didn't get it.
Sorry?
D and C.
Okay, yeah. So still 2 more tiles for you guys to go. I think you guys will be able to. Sorry?
I think I heard it wrong. Maybe like we got it right right now. The bigger tile.
Only Team D and C didn't get it.
Okay.
Oh, okay. Yeah. Cool. So still some teams haven't got the overall connect, but then I'm sure they'll get it as more tiles are revealed. So moving on to the next question, it'll be Team B's direct, B for ball. Which question would you guys want to choose?
Question 4.
Question 4, huh? Yeah, okay. Going ahead with question 4. Over to Venkatesh.
So in the Latin language, this word for a handle as of a jug or a loop as might hold on a sandal. So basically the word is derived from that particular word in Latin language. So in anatomic terminology, it is used for naming of structures in the neck and brain. So what term I'm talking about? So basically it's a term that's derived from Latin language, which means a handle or a loop, a handle of a jug or a loop on a sandal. So I'm opening pounds for this. We'll be giving 15 seconds, that's straightforward. And it's an anatomic terminology. It's used for naming structures in the neck and the brain. So what term I'm talking about? I'm closing. 3, 2, 1. Pounds closed. This is a direct for what team? Giri?
Team B.
Team B. Okay. Neha, did any teams bounce?
Yeah, Team C and Team E bounced.
C and E bounced. Okay, Team D, do you have an answer? Team B? Hello?
Is it
Sorry?
Arch?
Arch. Okay, ARCH.
ARCH.
Okay, the question passes to Team A. Team A?
Trochlea.
The question passes to Team F.
Manubrium.
The question passes to Team D.
Callosum.
Sorry, that's not what I was expecting. That's question. That's all right. Yeah, okay. So, Neha, did C and E get it correct?
Yeah, they got it right.
Okay, so the answer for this is ANSA, which means loop. So yeah, in the neck you have ANSA cervicalis, and in the brain you have ANSA lentigrosum, which is a part of the basal ganglia. So yeah, that was what I was expecting for. So now going back to the tile. So team C and E got it right, Neha, right? Am I right?
Yeah, yeah, plus 10 for both teams.
Okay, so now, yeah, I'll just be clicking on the tile for question 4, and gives you a much more important clue.
Bounce is open.
Yeah. Now, note that the points for this will be plus 10, minus 5. So you haven't got much to lose actually. So maybe you can try only if you're really sure of what the pathway may be. So
We're closing pounds in 3, 2, 1. Pounds closed. You heard anyone pounds?
Oh yeah, Team C and Team D bounced. Just a second.
Team C and D, right?
Yeah, Team C and D.
They get it correct.
Team C got it right. Team D, just give me a second.
yeah, just having a slight issue with the text here. Yeah, just give us a second.
Okay, so sorry. So Team C and Team D both got it right.
Okay, fantastic. Yeah. So team so have all the teams got the pathway as such?
Yeah. Yeah.
Oh, okay, fine. Okay, yeah.
So yeah, so this is I'll reveal the answer, please.
We are sure that everyone's got it right?
Yeah, everyone's got it right.
Yes, everyone's got it right.
Okay, plus
Yeah,
10.
so,
okay, so yeah, that was the last time. Yeah.
Yeah, so this is Rappaport Leukocytic cycle. Is also called as 2,3 BPG shunt, which is a metabolic pathway in RBCs. So yeah, that was what we're expecting for. We'll give you marks if you have given 2,3 BPG shunt or even Rappaport Leukocytic cycle.
Okay, great that all of you guys got the overall connect. I think some teams did score high in this round. I think one of the teams really went for it, going for it in the first box itself, and they got it right, and hence they got plus 30. And then a couple of other teams got plus 25, so that will definitely boost their scores. Anyway, we are just left with one question in this round before we head to the last round. Will be Team A's direct, and that will be.
I'm sorry. Can you pause for a minute? I have data issues. Can I just pause for 1 minute? I'll be right back.
Yeah, no issues. Yeah, we shall wait.
Thank you. Sorry.
Yeah, Giri.
Yeah.
So could you please repeat the points, like who got the scores
For the picture.
Yeah.
Picture scores. Can
Team
you?
C and Team D got plus 10.
Okay.
just wait till, I think someone from Team F had some connectivity issues, so we'll just wait for them to come back. Yeah, we are running behind schedule. We are really sorry for that. But then the last round should be done really quickly. And then you'll just bear with us for some more time. I'm sure you guys are enjoying all the questions as we are going with it. But then once we are done with this round, and then I think the last round should be done pretty quickly. Yeah.
I have a question in general about the quiz.
Yeah, sure.
Will we get a PDF of all your collection of questions? I mean, they're really impressive.
Yeah, I'll work on that. Probably this set, I'll try sending it to you guys, and then you
It'll
guys
also be on YouTube. You can check it out.
And I think the video is going on YouTube, and as we are talking, it's being live streamed on the Doctors for a Cause YouTube channel. And the PDF, sure, I will. We will work on it, and we'll see that it reaches you. Yeah.
Thank you.
Are we good to go?
I'm really sorry. My teammate's data actually was running out. She's just connecting again. Sorry.
No issues. No issues.
Yeah, I got it. Thank you so much for waiting.
Giri, can we start back? Giri, can you hear me? Just a minute, guys. I think Giri and Venkatesh have just got disconnected. I'll try to get them back. Thank you for waiting. Giri, can you hear me?
Yeah, I can hear you.
We are good to start.
Oh, okay, fantastic. Yeah, okay. Let's go ahead then. Okay, so I think Team A's direct question 6 coming up. Okay, so the first incidence of an outbreak of X was in the 1980s at Minnesota and South Dakota, where more than 121 cases were identified in 9 counties. The patients complained of sleeplessness, nervousness, headache, fatigue, and excessive sweating. After further investigation, the reason for these symptoms was attributed to the method of butchering, wherein the muscles from the larynx of the slaughtered cow were ground into other cuts of the meat to make burger patties. This practice supposedly made the patties tastier, but however, the butchers weren't astute in cutting only the laryngeal muscles, which led to the development of these symptoms. So, what is X? The clues which are there in this question are clinical findings which are there: sleeplessness, nervousness, headache, fatigue, and other symptoms. Excessive sweating is there. And then the second paragraph has been given for a reason, where we are talking about the method of butchering, wherein the muscles from the larynx of the slaughtered cow were ground into other cuts of meat to make burger patties. So this practice made, like, because they were able to take the muscles from the larynx, it actually made the patties tastier. But then, butchers weren't astute in only cutting the laryngeal muscles. And I will stop with that. I'm not going to explain more about this question. Opening pounds for about 20 seconds. And I'll give you guys some time to discuss this answer with your teammates. Looking for a specific answer. Anything else on the pounds won't be accepted. So closing the pounds for this question in 5, 4, 3, 2, and 1. Pounds is closed for question 6. So, sorry.
Team B and Team E bounced.
Which teams bounced?
Team B and Team E.
Okay, B for Bombay and
All.
Team E.
Yeah.
And a team and Team E. Okay, fine. Okay, so Team A, you're direct. Do you have a guess?
Yes, Creutzfeldt-Jakob disease, bovine spongiform encephalopathy. That variant.
Passing to Team F.
Is it Fusobacterium?
Not what I was looking for. Team E pounced, Neha.
Yes, they bounced.
Okay, moving on to Team D.
Is it not going to diphtheria?
Sorry?
Diphtheria?
No, that was not what I was looking for. Passing to Team C, I guess. Yeah, C. Team C.
Cysticercosis?
No. So I'm sure there are a lot of people who are answering this question on our YouTube live stream. We're sorry, I can't respond to you guys in real time, but the DFC, our organizing team, is looking at it, and you guys will be getting special mentions, definitely. So the answer which I was looking for in this question is hamburger thyrotoxicosis. So if I go back to the question here, I'm talking about symptoms of hyperthyroidism, sleeplessness, nervousness, headache, fatigue, and excessive sweating. And here, what actually was the reason, why was it named hamburger thyrotoxicosis, was because the muscles from the larynx of the slaughtered cows were supposed to make the burger patties more tastier. Hence, they were used in hamburgers. And people who had these hamburgers from Minnesota and South Dakota, they developed symptoms of hyperthyroidism. And an actual study was done with 121 cases and all that. And that's how they finally got to the point that it was because when they were cutting the laryngeal muscles, a bit of the thyroid tissue also got into the patty. So the thyroid tissue of the cow. So due to the extra thyroid tissue which was being ingested, it resulted in the symptoms of hyperthyroidism. So the answer for this is hamburger thyrotoxicosis. Neha, did the two teams get it right on the pounds?
No, they didn't.
Oh, both the teams.
This is also called as gullet. And this process is also called as gullet trimming.
Yeah.
Both got it wrong, so it's -5 points for a team.
It was team B and Team E, right?
Yeah.
So no one got it on the pass. Team B and Team E get -10. And just going back to the time.
-5, right?
Sorry, -5. Sorry, scorers, please.
Was it Team B or Team D? B for ball?
Ball. Yeah, B for ball.
Okay.
Yeah, so sorry. -5. Team B, Team E get -5. And none of the teams answered it on the bounds. Okay. So that will bring us to the end of round 4. And can we have a look at the scores right now, please? Namrata, over to you.
Namrata, can you just share your screen?
Yeah, just a second. Is the screen visible?
Yeah.
Okay, so we can see that team B is coming back into it. We are having they were initially on 0 points, but then now they're on 85 points and are fighting for the third place. And then we have Team E has taken a lead of 20 points. Team E is on 155, and Team F not far behind on 135. Then we have Team B, and then Team C on 50, Team A on 45, and Team D on 22.5. So I hope there are no discrepancies in the scoring.
Just one thing. I think our score might be, I'm not sure, but I think we had answered 2 questions correctly. So we should, I think, be at 60, not at 50. We had pounds for 1 question, the answer of a question, and we got the picture.
Yeah, but then you also answered the time.
Yeah, I think you got a negative, right?
Yeah, -10 for the third third time when the tile was revealed. You guys answered. You got.
Shouldn't it be -10 plus 20?
No, I think you guys answered it later when 4 tiles were revealed, right?
When the 4 tiles were revealed, that is when we answered for the picture quiz. So for that, we get a +10. We had bounced for the answer question. That is why we get +10 again, so +20. And earlier, we had answered a wrong answer to the tile question, so that would have been -10. So it goes +20 and -10. So we should be getting 60, isn't it?
Extra +10.
Answered last, right? Team C and D answered last for the 2-3 position.
But wasn't it like if one tile was left, then there would have been 5? If two, wasn't it supposed to be 30, 25, 20, 15, then 10?
Yeah, so you got a -10 because you went for the guess at +20.
Went for a guess and that was wrong. Then
Yeah, so at that point we were at 40, and after that we answered two correct ones. We gave 2 correct answers, so we should be at 60, not
60, isn't it?
Oh, are you telling me you answered? You gave another correct answer on the one of the questions?
In the last round, we had given 2 correct answers. One was the answer question, and one was the picture question. In the end, when 10 marks was up for grabs, and before that, we got a -10 because we had tried to guess but got a negative marking.
Neha, can you? Neha, can you
give answer right?
Yeah,
Yeah. That question was right, and the same question, the tile was also revealed, and they got that one also right.
So I think they will get a +10 is an order. Okay.
Thank you.
Yeah, no
Thank
issues.
you. No issue.
Let us know if you have any problem. Yeah. Don't worry about that at all. Okay, so Team C is at 60, and I think I think the other teams don't have an issue with the scoring. So we are going into the last round. Just have a query from someone. 1 second. Just give me a second. Okay, sorry, one of the teammates had a query. I just answered that to them, and I think we are good to go for the final round. So since we had last 2 rounds, we had 2 rounds as clockwise, 2 rounds as so for anti-clockwise. This round will again be clockwise. So okay, this is a very different round. I think you guys wouldn't have seen it before on a quiz. So we are calling this round Foodies Assemble. So this is a rapid fire round. Most of the quizzes at the end, we do have a rapid fire round where each team will get a menu of sorts based on what they choose. So each menu will have 6 food items, and the words highlighted in bold will point towards some entity. It can be pathological, radiological, anatomical, anything. So each question may have more than one answer. Like if there is some text there will be some text in bold, and you'll have to connect it to some pathological, radiological, or some entity which you know in the field of medicine, and you just have to give me any one answer. You don't need to give me 2 or 3 answers. Even if you know, just give me any one answer, and you get 5 out of those 6 items right, and you get a free beverage. There will be a sample menu which I'll be showing you guys, and this will help you guys understand the round better. So, and then in the rapid fire round, there will be 6 items in the menu. 6 items in the menu in a rapid fire style, and the time I'll be giving you guys to answer those 6 questions, sorry, I haven't mentioned it in the slide, 45 seconds for those 6 items. And for each right answer, you'll get +5. And out of, then there's one more bonus points up for grabs in this round. So if you get out of the 6 items, if you get like 5 items right, then you get a free beverage that is in the menu. That will be a bonus item sort of thing, and that bonus question will be worth 10 points. So I'll just show you guys a sample menu of how it's going to look. This is not the
Do we have negative marking in this round?
No negatives. You can feel free to guess. It's going to be a rapid fire round, so just try to guess whatever comes to your head, and you might be right. Yeah.
If we pass a question for the time being, can we get back to it if it is within the 45 seconds?
Yeah, within the 45 seconds,
you
can get back to it. Yeah.
Okay. Thank you.
But then we won't reveal if it's right or wrong. You'll know it only when we reveal the answers.
Excuse me.
Yeah.
Once if it's attempted, can we attempt it again? Like assuming we just committed a mistake and then can we rectify?
Yeah, you can
within
attempt
the
it again.
45. Yeah, within the 45
within the 45
seconds.
seconds.
Yeah.
But then we won't tell you if what you're told is right or wrong.
Yeah, that is fine.
Okay, fine.
Excuse me. Each question is 10 marks or 10 or 5 points.
5. So I'll just show you the sample question. So this is just a sample question. This is how the questions will look. So as you can see here, first you get a menu of 6 items like starters, main course, desserts. We've named
I can't see what you're.
Oh, sorry. Just give me a second, I think.
Giri's screen share is off.
Oh, yeah. Just give me a second. Guys, can you see my screen? Just send me a thumbs up if you guys can see my screen and if everything's good to go. Garima, is it fine? I think you can see it now.
Yeah, we can see it.
Okay, cool. Okay. So yeah, this is how the menu will look. So we've tried to design it in restaurant style sort of thing, like so Cafe de Paris, and you can like there will be 6 menus like this, and then each menu will have items with whatever items you will find in that particular place. As I go to the next style, you will understand. So here you can see that I've highlighted some words in bold, like Swiss cheese, onion skin, honeycomb, cayenne pepper, agu cake, green apple, and all that. So you guys have to correlate something in bold with some medical terminology. For example, Swiss cheese, you can see we spoke about it. One of the types of leprosy is Swiss cheese. Onion skin is going to be Ewing sarcoma. Honeycomb lung is a characteristic feature. And agu cake. And if you don't know anything in this particular sequence, then you can always come back to it. So I'm going to give you 45 seconds for these 6 entities. And here there will be a bonus question. So if you get, so at this point we will reveal if you've gotten at least 5 of these 6 right. So if you get at least 5 of these if you get at least 5 of these 6 right, then you will be eligible to answer this bonus question. This bonus question will be worth 10 points if you get it right. No negatives anywhere. You can feel free to guess. So I think that's that about this round. And coming to the main tile, so yeah, these were the answers.
1 second. They're all different. Yeah, okay. Thank you.
I told Neha to note down the answers what they tell you, so if you can check it later.
Oh yeah, Neha, can you do that for us?
Yeah.
Just make a small note of what they're answering for each thing, so that in case if there's any discrepancy, we can go back to it and look at it.
Yeah. Okay.
Just a question. Like each team, we are 6 teams, so 6 teams will be given 6 different menus of our choosing or your choosing.
You guys will choose.
Okay.
Give you the menus and you'll choose one menu from that.
I will go.
And we'll have to make. We have to make such correlations.
Yeah.
Okay.
The menus
And
correlations will be something like this.
Yeah. And we'll be like talking to you at the same time and talking to our partners. Like 45 seconds is a.
Either one of you can answer. Like it's a rapid fire round, so yeah.
You can talk to your, because the thing is, this question is not going to be for anyone else. It's going to be one team, one question. It's not going to go for anyone. So you can discuss with your teammate on the call itself.
Yeah, you both can keep your speakers on, and you can
keep your mic on, and then you can discuss on the call itself. And then
if we don't keep the mic on, we just like suppose take the first 15 seconds to answer whatever we can. And then like it won't be a problem if we do not keep the mic on.
Right? I just get the answers from your side.
Yeah, you just want the answers, right?
Yeah,
so,
just want
we just want the answers. Within 45 seconds, we just want the answers.
You guys can still be on the call. Probably your teammate can keep telling you the answers and you can tell it here. Up to you guys. That's your choice.
Okay, thank you.
Okay. So
also, sorry, one more thing. Sorry. Also, if we have like a slightly different answer that's still related to the whatever's on the menu, is that okay? Like for example, like for green apple, we said green apple perfringens, or
that's
berry, we said berries ligament.
I did mention that before. So for Swiss cheese, endometrial hyperplasia also I forgot to point that out. So sorry. even for onion skin, hyaline arteriosclerosis can be another possible answer. So, so for one particular entity, you just have to give me one of the answers. 2 or 3 answers may be possible for a given entity. You just have to give me one of the answers for the points. Yeah. Okay. So moving to the menus. So these are the 6 menus which we have for you guys. And since we went anti-clockwise in the past 2 rounds, we'll start clockwise in this round. Sorry.
Can I just have a minute?
Yeah, sure. We'll wait. No problem.
Just a minute, just.
Yeah. Just let us know when you're back. So yeah, there are 6 menus, and we've named each menu for a reason. It's the stuff which you'll find in that particular place. So can probably, I don't think it really gives an edge in terms of anything, but
Giri,
yeah,
can you
maybe.
just repeat the scoring once again?
Okay, the scoring, I'll just go to my previous slide so that's better. So yeah, if you guys get these first 6, that is before the beverage, if you guys get the first 6, one of the first 6 questions right, it'll be +5 for each, +5 for each question. So a maximum you can, if you get all the 6 right, you'll get a +30, and if you get 6 right, you'll be eligible for the bonus. So that will be +30 +10 if you get the beverage also, so +40 from this round. And then, but then even if you get 5, you'll be eligible for the bonus. So 5 out of 6 is 5 into 5, 25 points, and then another +10 we get, so we'll give +35 points. So yeah, those are the highest possibilities you can, highest possible scores you can get in this round. So yeah, I can see that there's only a 20 points difference between the first place and the second place. So the second place can actually catch up with the first place, and yeah, we can see a change in the final scores as such. So yeah, we are heading to the menus. Team E, are you back?
Giri, 1 second.
Yeah, sure, no problem.
Yes, we're back. Yeah.
Just give me a second.
Girish will be back in a minute. Thank you guys for waiting. I hope you guys are enjoying. At the same time, yeah, it's going quite interesting. I know it's a pretty long time. We're so sorry for the delay, but I hope you guys are enjoying. It'll just take some more time. We already almost in the last round, and just should be a rapid fire. So we shall finish soon. Thank you. Giri, can you hear me? Giri and Venkatesh shall be back. I am so sorry for the delay, guys. I know it's getting late. We'll start soon again.
I just wanted to ask, is there any pass or anything like that? There isn't, right?
No,
No,
this
there's no pass. There's
No,
no
no
pass.
pass in this round. Just each team will get a question, and then we are done with it. Yeah.
Yeah, we're good to go.
And also for this round, like because we want to on both of the participants' mics, so there'll be no use of talking on the phone. So like it'll be better if you can cut the call because you can speak on the meeting.
Okay. Because the idea of this round, like when we were making this round, we wanted to make this because the fact that we are having this entire thing on an online platform, we are not really able to interact with the participants and all that. But we wanted this particular round alone to be interactive. So we wanted both the teammates to switch on their mics and actually discuss it, like how it would be on stage, and try to replicate that exact scenario over here. So it's just a small attempt from our side. So it would be really great if if you guys can cut your phone call and then actually talk on the Zoom call, so that we get a bit of a taste of how real quizzing actually is. So this is why we would like to request all the teammates to actually cut their phone call and to discuss on the Zoom call itself, because at the end your questions, like all the 6 menus are unique completely. Like there is no all the entities are really different. So there's not going to be any overlapping of any sort. So we would like you guys to switch on your cut your voice call, and then probably once you're done with this round, once you're done with the 45 seconds, once you're done with the bonus also, then you guys can go ahead and just get back to your phone calls. So is that okay?
Just when your round comes, we want you to off your phone calls and talk on Zoom meeting.
Yeah. So does anyone have an issue with this? I think no. I think most of the teams are good to go with this. Thank you so much. I think not everyone is really open to discussing their answers on the Zoom call, but then thank you so much for accepting. So without further ado, we are going to this is the last round of the DFC medical quiz, and we will be starting with Team A. Team A, which menu would you like to choose?
We'll take Indian Tadka.
Okay, cool. Venkatesh, are you keeping a timer?
I am keeping my timer.
Okay, cool. Okay. So going into
Indian. My teammate has been disconnected.
Sorry?
My teammate has been disconnected.
Okay, we shall wait for him. Yeah. Just let us know when he's back. Yeah.
Simran. Hello.
Prithvi, you are on. You are unmuted.
Oh.
Like. Oh God, it's okay. Calm down.
We're so sorry, guys. One of the teammates have just got disconnected. We'll get them back and we'll start again.
Yeah. Perfectly.
I think
You are muted, Garimati.
I think Team B's teammate has joined in.
Are we good to go?
Team B? Team B, are you guys here?
Yeah, one of us is here, but I think my teammate is having a problem with the audio.
Archan, and can you just check your audios once? Team B, Archan and Prithvish?
Yeah, my audio is fine and full.
Archan, can you just check your audio?
Yeah, my audio is fine.
Prithvish, can you check your audio? I think he got disconnected again. So we'll just wait for him to get connected again.
Yeah. No issues. No issues. I think this round will decide who the winner of the quiz is, because I think Team E is on 155 and Team F is on 135, if I'm not wrong. So based on how each team does in the round, I think we'll have a winner. I think third place also, I think they can catch up. We'll see. We'll see how it goes. Yeah. Yeah, we have the scores right now. Okay, so a maximum of I think we said 30 plus and 40. Okay, that leaves Team B a little short of the second place, but then still third place still up for grabs. I think Team C, Team B, they have just 25 points gap, so that can be easily made up in this round. And yeah, team A can also, so Team A probably, if they can get a full 40, then yeah, they are on 85 points, so that will make it a bit interesting. So yeah, we will see how it goes, and we'll just wait for all our teammates to join back in.
Team B, I think Trithpish's voice audio has been disabled. He has to connect to his audio. I think it is disabled. It's not showing that his mic is on. He has to connect the audio to the Zoom internet.
Isn't connected to the Zoom call right now. Just called me. Unless he's joined since.
Yeah, he's joined, but he's not connected to his audio. Team B, what we can also do is, if you wish, you can, any one of you can answer on behalf of both of you, and you can be on, if that is a problem from your side, if the audio is not working for any of your teammates.
So have we got the issues sorted with Team B?
I don't think Team B, Prithvish is trying to reconnect again. His audio is not connecting to the Zoom. Just 1 minute, Geerita. Sorry for the delay.
So till then, if any teams have any feedback about the quiz so far, you guys can just switch on your mic and say something if you guys want to say. So like, yeah, you guys have been with us for like, I think close to now.
So sorry, Giri. Team B, Arjun, can we do this, that you can stay on call, voice call with your partner? If he can just connect to the video and see the questions, and you can be on WhatsApp call with your partner, and you can answer on behalf of both of you.
Okay, his video hasn't connected either.
Yeah, because he was not connecting to the audio. That's why. Can you ask him to just connect to Zoom so that he can see us?
Try connecting to the.
Yeah, just
Okay, since we are running behind schedule, Garima, I have a suggestion. So can we just be done with the other teams and come back to Team B at the end if it's possible?
No issues. Team B, is it fine with you?
Like it's going to be just one question per team.
Yes.
Yeah. So
Team B,
is it okay with you guys?
Arjun, we can start with. Okay,
can
great.
we change our option to Grand Sunday brunch, please?
Team A wants to change their option. Okay, no issues.
I think I've not seen the menu yet, so I don't think it's really a problem. So okay. Venkatesh, do you have the timer ready?
Yeah, I have the timer ready.
Okay, fine. So the first menu from Foodies Assemble is going to Team A. That is a Grand Sunday brunch. Okay, so Team A. Venkatesh, just reset the timer.
3, 2, 1. Yeah.
Yeah, I'll give a countdown. Yeah. So, team A, both your mics are on. Just give me a test.
Yes.
Yes.
Okay, cool. So
please make note of the answers.
Yeah, Neha, just keep a note of the answers.
Yeah, sure.
Okay. So team A, your time starts now.
Bread and butter pericarditis.
Pericarditis. Maple syrup urine disease. Port cell carcinoma. Then pancake. Scrambled egg appearance of that is poached egg. Scrambled.
22 seconds.
Did you answer oat cell?
Yes, oat cell.
The answer oat cell.
Raisins.
15 seconds. You have an answer: raisins, scrambled eggs, and pancake. 7 seconds. 6 seconds. 5, 4, 3, 2, 1.
Mycoplasma pneumoniae, scrambled eggs.
What was the last answer?
Scrambled egg?
The colonies of Mycoplasma pneumoniae are scrambled eggs.
Okay.
It doesn't look like a scrambled egg. It looks like.
It looks like a poached egg.
Yeah, poached egg.
Yeah. I think
Scrambled egg is more specific.
Yeah. Okay. So I think
they got 3 right.
They got 3. They answered 3 and they got all the 3 right.
Yeah. So I think moving on to the because they got only 3 right, they won't be going for the bonus question. Bonus question is pretty easy. You guys just want to guess?
Chocolate cyst in the ovary.
Endometriosis of the ovaries. Perfectly right. So moving on to the answers. So yeah, scrambled eggs was Best vitelliform degeneration, macular degeneration. That's what we were looking for. Bread and butter, you guys got it right. Fibrinous pericarditis. Pancake is omental tuberculosis.
Oh shit.
And also a pancake brain also we could have taken as an answer, but in the key we just given tuberculosis. Maple syrup urine disease, you guys got right. Port cell carcinoma of the lung, perfectly right. And racinoid nucleus are seen in the coilocytes of HPV infection in cervical carcinoma. So the precursor, that is. So you can see coilocytic cells with racinoid nucleus. And chocolate, as you guys said correctly, endometriosis of the ovary, but bonus doesn't count. So team A answered 3 out of 6 right. So that will be plus 15 to team A. Well done. So moving back to the tile, we are done with Grand Sunday Brunch, and now it will be team B's turn. Team B. Oh, sorry. Okay, team B, we will be coming to you guys at the end because they're having a little bit of issues with their Zoom call. So we will move on to team C. Team C, you guys here?
I think they've joined.
Team B is here. Team B, Prithvish, can you switch on your mic and check it if you can hear us or talk? He got disconnected again, I think. No issues. We can go ahead with Team C then.
Okay, fine. Team C, can you guys just switch on your mics and tell me if you're here?
Utsha?
Yeah.
We candlelight dinner?
Okay, candlelight dinner.
No. I mean, I'm just asking my partner.
Oh, okay.
It's fine. Yeah, it's
sorry.
fine.
Sorry.
Yeah. Okay.
Candlelight dinner?
Yeah, it's fine.
Okay, candlelight dinner, please.
Okay, fantastic. So going into candlelight dinner buffet. Venkatesh, you got the timer ready?
Yeah.
Okay. So we'll be starting this round in 3, 2, 1, go.
There's nothing. Okay.
Yeah. Okay.
Anchovy sauce in amoebiasis.
Okay.
Red currant jelly.
Salmon patch in syphilis. There's a cat salmon patch on your eyes. It's a disease.
Keep going.
Crab legs.
You have 20 seconds.
Crab legs is some cancer.
Go to the next one. It's
red
fine.
currant jelly can be there in polyps if there are.
You have 6 seconds. 5, 4,
spaghetti and meatballs
3,
will be there in
2, 1. Yeah, you said tinea, right?
Yeah.
Okay.
I think we'll take it. I think we'll take that answer because I think there was a bit of a lag.
Yeah.
I think I saw them answer. I think anchovy sauce. I think they
answered anchovy sauce and spaghetti with meatballs.
Spaghetti meatballs.
Yeah. Okay. Yeah. Nice. And then the bonus drink for this round was champagne bottle. Any guesses? Just for no points.
Champagne bottle. Can I answer?
Team A wants to answer. Go ahead, Team A.
Yeah, no problem.
Hypodermatosclerosis inverse champagne bottle appearance.
Yeah. Okay.
Or
That's
champagne
also...
sign in papilledema.
Yeah. Does anyone have? There's also one more answer possible.
There are actually two more answers.
I think yeah, two more actually. Does anyone want to switch on?
Varicose veins, you get that due to lymphatic blockage, there'll be collection on top and then below. So it'll form like a champagne glass appearance, champagne bottle appearance.
That's hypodermatosclerosis.
Yeah. I think that is what the team guessed. Yeah. So yeah, just moving on to the answers. Okay.
Saute crab legs is seen in invasive ductal carcinoma, and then spaghetti with meat appearance is tinea versicolor. Then grilled salmon is Pityriasis rosea patch because it's salmon colored. You could have also answered psoriasis. You had given marks because psoriasis also you have salmon colored. Then the cut cabbage is fibroadenoma, which is also called breast mouse. Then anchovy sauce sputum is you see in amoebic abscess, liver abscess because of fistula between the lung and the liver. Then red currant jelly sputum, intersusception, Klebsiella pneumonia, and even mesenteric ischemia. Everything is correct. Then champagne bottle is seen in MC-minus cholecystitis and Charcot-Marie-Tooth disease. It's called as inverted champagne bottles.
Yeah. Okay. So yeah, I think team C got two answers, right? I think
two answers.
Meatballs, tinea. They said I think because of some lag and all that. Venkatesh, just give extra 5 seconds because I think some teams are having a bit of a lag with my slide and us starting the time exactly. So extra 5
give 3
seconds.
5 seconds.
Doesn't make a big deal.
Okay.
Does it? I think just give if there is any answer which comes after time up, then just give it to them because we are having a bit of lag when we are
I'll see 3 seconds.
Okay, fine. Okay, I think that should do. And so these were the answers for this round. I think Team C got 2 right. Spaghetti media. Okay, I think Team C, you can mute your mics now. Anchovy sauce, they got amoebiasis right, and spaghetti with meatballs was tinea versicolor. I think they got that right. So I think plus 10 for Team C. Is that right, Winky? Okay, cool. So Team C get 10 points. And now we'll be moving on to Team D. D for Delhi. You guys here?
Yeah, we are ready.
Okay. Which menu would you guys like to choose?
Colorado Ranch.
You guys are going with Colorado Ranch? Okay, fantastic. Okay, so moving into the Colorado Ranch. Okay, Venki, you got the timer ready?
Yeah.
Okay. Team D, both of you guys are ready?
Yeah.
Okay, so starting this round in 3, 2, 1, go.
It's not.
Onion bulb sign. Onion bulb sign.
Onion bulb sign. No.
Just scan through the whole thing and see what you can get.
Yeah, what you can get, just fast.
Just answer. Just give it an attempt.
After 18 seconds more.
No.
8 seconds. 6.
Guys, give it a try. There's no negative.
5, 4, 3.
You can wire
1. Yeah, that's it.
I think Team D couldn't really crack it. Do you guys want to take a guess for the bonus question? Team D?
Anyone else also wants to? Team D? Anyone else from all the other teams wants to take a guess for team this last question?
Yeah, that would be fantastic.
Is that hot potatoes for the carrot
hot potato voice.
carotid body tumor we got. Hot
Yeah,
potato
hot
PLA.
potato.
I got
No,
an
it's
answer.
hot
Hot potato voice.
Periconsular abscess or Quincy.
Ladentia spleen.
Yeah, Laudatius.
Laudatius spleen is right.
Seen amyloidosis.
Keratic precipitates.
Mutton
Yeah.
fat cells.
Mutton fat carotid precipitates.
Keratin.
Yeah.
Alcoholic
And
liver.
chicken wire pattern in that. Cirrhosis of fibrosis.
Cirrhosis is correct, and even oligodendroglioma, the
Oligodendroglioma,
calcifications.
yes.
Yeah, it's called chicken.
And onion bulb.
Then onion bulb is seen in Tay-Sachs disease. The appearance of the
You can see the answers, Giri and Venkatesh.
Going to the answers. Yeah, I think the other teams together got most of the answers. Hot potatoes, voice, and Quincy, and shredded carrots is plexiform neurofibroma, and onion bulb is seen in Tay-Sachs disease. I heard that answer as well. Chicken wire, oligodendroglioma, mutton fat keratic precipitation, granulomatous uveitis, and pig's lard, lardaceous spleen, splenic amyloidosis. Sugarcane juice is seen in acute glomerulonephritis. Amazing quizzing, guys. Team D, you guys, Team D missed out a bit, but then that's completely fine. No problem at all. So we will be going. So we are done with 3 menus. 3 more menus left. I think we are coming to Team E and Team F. I think right here the quiz, the winner of the quiz is going to be decided. So going back to the menu and to you, Team E, which menu would you like to choose?
Indian Tatka.
Indian Tatka. Okay, fine. So Team E, just check if both your mics are working.
Yeah.
Right. Okay.
Yeah. What menus are left is, I think, Indian Tatka, the Thick Shake Factory, and County Carnival. These 3 are left. And yeah. No problem.
Ani நீ சொல்லாதடா பாஸ் பட்டம் மட்டும் நீ எடுத்துக்குடா அனி.
Colorado Ranch is still there?
Colorado Ranch just now got out.
Okay, sorry.
Okay. Team E, can we get started?
Yeah.
Okay. Venki, do you have the timer ready?
Yeah.
Okay. So just account for the lag also a bit.
Yeah. Fine.
So we'll be starting in 3, 2, 1, go.
Lemon is micromeningocele.
Candidiasis HPE, lemon-on-stick appearance, Cushing syndrome, steamed riced bodies. Okay. Nutmeg
is CVC.
CVC. Coconut cake.
Coconut cake is trichuriasis.
Trichuriasis. 1, 2. Lemon-on-stick shish kebab aiche. Malabar rice bodies idlada.
Rice bodies. Rice body stool in cholera.
Rice watery stools in cholera. Fish flesh. Fish herringbone pattern.
12 seconds more. 10 seconds.
Fish
Sheikh kebab, you said?
Yeah.
Sheikh kebab. Okay. You have 1 more. 2, 1. Yeah, that's all. The time is over.
One last.
I accounted for 3 seconds.
Ani. Mute. Okay. Done. Yep.
Okay, fine. I think they got 4 right, Venki.
Yeah, they got 4 right.
Sea kebab, candidiasis, pseudohyphae was right. Lemon on a stick, Cushing syndrome. Nutmeg pickle was CVC liver. Coconut cake is trichuriasis. Yeah, perfectly right. Just
steamed rice bodies is rheumatoid arthritis. The organizing fiber in the joint spaces is called rice body appearance, and fish flesh is lymphoma appearance.
Yeah. Do you guys, for no points, do you guys, the beverage is fairly easy, so you guys can just guess it for no points.
Lassi enada varum?
Curd is highlighted. Yeah, sorry.
Curd is highlighted.
Curd.
Very good.
I think it was. I think
it's curdy discharge seen in vulvovaginal candidiasis.
Curdy discharge. Yeah.
Okay. Yeah. So really good quizzing from Team E. I think they've so far the best performance in the rapid fire round. So congratulations to them. So the answers we just discussed it. We were looking for they said, but since rice bodies has a very specific terminology with respect to rheumatoid arthritis, we can't take rice watery stools. A very good guess though. And fish flesh appearance is seen in lymphoma, also seen in Wim's tumor, and in a few other I think retinoblastoma also. I think I've read that.
Hodgkin's, yeah, anything.
Yeah, any many tumors it is seen in. And yeah, curd was vaginal candidiasis. So great job, Team E. I think 4 out of 6 also is a really good performance, and I think it's a score to beat for now. I think 20 points from this round has been the highest score so far. I think we have 2 more teams to go. So scorers, please note 20 points to Team E, which leaves them at 175. And
yes, 175.
175. Team F at 135. It is a huge task from them. They'll have to get maximum points possible from this round, and if they do, then we are in for a tiebreaker to decide the winner of this quiz, and that will be something which will be really interesting. So going back to the main slide, Team F, you guys are here?
Yes. Yeah. Ranjan? Ranjan? Yeah. Okay. Yeah. So you want to take the one that we discussed, right?
I think Team E has a question. Yeah, tell me, da.
Hey, one நிமிஷம் போயிட்டு வரேன்டா.
No problem, da. Yeah, no problem, da. Take your time. No problem. Yeah. Okay. So yeah, Team F, I think. Yeah. So Team F, what is the choice of a menu?
What do you want? Ranjan, county carnival?
Yeah, county carnival maybe. Let's just go.
Okay. Yeah. Okay. County carnival.
Yeah. Okay. Cool. So county carnival is what we'll be going with. Venkatesh, do you have your timer ready?
Yeah.
Okay, cool. So I'll be starting county carnival in 3, 2, 1, go.
We can't see. Okay. Okay. Blueberry is torch infection. Sugar icing is that sugar icing appearance in
apple jelly is in lupus. Then donut is lymphoma.
Sausage is a psoriasis, that arthritis, the sausage shape arthritis.
Yeah, okay. Can you be apple jelly more specific? What lupus?
Even the arthritis, psoriatic.
Yeah, okay, fine. Sausage, fine. Yeah, sausage, fine.
Donuts, that sugar icing is that sugar icing appearance in this thing, dude.
Yeah. Okay.
Yeah. Then after that.
What is sugar icing appearance?
Huh?
Sugar icing appearance, what is it?
That what's it called? In the perisplenitis.
Okay, next one.
Perisplenitis.
Yeah, okay, fine. Yeah. You have 6 seconds.
Donuts is what, bro?
It's in lymphoma only, no?
Cotton candy.
Cotton candy is what?
Cotton candy is chip.
Okay, yeah, time up.
How many did we get?
Blueberry was not specific.
Blueberry for rubella. It's the rash seen in rubella.
Yeah. Neha, it's fair. Yeah, it's fine. Correct. They said sugarizing, blueberry, sausages.
Blueberry, apple jelly.
Donuts, you said, huh?
Donuts, they were like lymphoma, but I think
no, that's not.
Yeah, lymphoma is not what we are looking for.
Okay, they had sausages, right? And then blueberry, then sugarizing, yeah, and apple jelly.
Apple jelly, we are looking for a specific type of lupus. So do we give it to them, or how do we go about it?
Do you, can you tell us now, like lupus? We'll ask them now.
I think
they said. What?
Can we answer now, or?
Yeah. What did you mean when you said lupus?
Lupus vulgaris, no?
Yeah, Giri, should we give marks for that? They said.
I think it does not really change the standings as such, but yeah. So fine. I think it should not be a problem. Yeah, we can give them the marks.
So 1, 2, 3, 4.
Yeah, you guys also got 4. Really amazing quizzing. I think
donuts you won't give. Donuts it's for.
Okay, donuts.
What did you guys say? Donuts.
Donuts. I don't know if it's like. I know it's large only, but I don't know which one. I'm not sure.
Any of the contestants have an answer for donuts?
Donuts sign intersection.
Yeah, that's one.
That's one.
Apple jelly, scrofulloderma. Apple jelly nodules in scrofulloderma.
Yeah,
that's correct. Yeah, that's what they answered. Donuts, there's one more. Do any of you want to take a guess?
Even cotton candy, no one said, right? Cotton candy.
Cotton candy is end stage emphysema. Cotton candy lung.
Yeah, in what specific condition is cotton candy seen in the lung?
End-stage emphysema.
Looking for a little more specific answer, actually.
Specific.
Yeah.
It's an infection.
Yeah.
Okay, so cotton candy is in pneumocystis jirovecii pneumonia. The exudates is referred to as cotton candy exudates. And sausages can be psoriatic arthritis. Yeah, all that's correct. Then donut granuloma is seen in Coxiella burgdorferi infection.
Oh, Q fever.
Yeah, Q fever. The granuloma is referred to as donut granuloma.
Forgot about the beverage.
Donut cells, I think, are in that lymphoma, right? In that large.
Yeah, there in yeah.
I think that's horseshoe shaped, if I'm not wrong. It's large cell lymphoma, yeah, but isn't it horseshoe shaped?
Yeah,
okay, just give me 1 second for checking. Come back. Okay, then blueberry muffins, yeah, you said it right. Sugarizing is seen in perisplenitis. Then the beverage, Coca-Cola. Anyone else take a guess?
Cola urine, that Coca-Cola urine kidney, what's it called? Glomerulonephritis. No?
Post-infectious glomerulonephritis.
Yeah,
PSG. Giri, you can reveal the answers.
Yeah. Going to the answers, like.
I'll be back once.
So if we did get donuts, then we got Coca-Cola too, right? Because then you would have reviewed.
You would have got 5.
But you guys, like within the time.
Yeah, but I think donuts. Given the fact that we have a donut sign in interception, there's granulomas in Q fever, and if you had specified donut cells in lymphoma or something, you just like lymphoma. So, yeah, just give us a second. We'll just look into it. Yeah.
I just checked Robbins and it said that in large cell lymphoma, you see like horseshoe shaped nuclei. They're called as hallmark cells. And so I don't think donut is the answer.
Okay, cool.
Giri, did you check somewhere?
Yeah, I was just, I think, there are.
You said large cell lymphoma, right? I think all hallmark cells and they possess a horseshoe.
For sure, but
they possess horseshoe nuclei and they call as hallmark cells. So that's what you know.
Okay, cool.
Okay, fine then. Are we good to go then? Hello.
Giri, 1 second.
Yeah, I could find.
Even I can find.
Yeah, I think you just check it.
Yeah. We have donut cells in large cell lymphoma. Yeah, it's there in the net.
Excuse me, Giri.
Sorry.
Giri, even if they have got 5 right, and then the last one they are going to get 35, it's not going to change that. It's going to be first and second down.
I guess what team is saying, I think is right. But then I mean, we can say that the first place was contested really tightly at the end of the day. But okay, fine. Team, we get your point. So okay, we will give it to team E.
Yeah, we'll give it to
for getting donuts right, and I think that's the best performance in this round so far. So they got sausages right, so psoriatic arthritis, and then you got donuts. Yeah, donut cells. We were expecting donut sign for interception or granulomas in Q fever, but donut cells is right. We will give it to you. Blueberry muffins, rash seen in cytomegalovirus neuroblastoma, or even in rubella, you can see blueberry muffin rash. Sugarizing, perisplenitis, apple jelly, lupus vulgaris, and because they got 5 right over here, they got the bonus points also for the beverage, which is 10 points. So that is 25 plus 10 points, 35 points from this round. That is the highest score which we have got in this round. And that actually decides the quiz. I think I think this leaves them at 135 plus 35, 170, whereas Team E had scored 20 points, which was enough to give them 175. Really tightly contested. Great quizzing, guys. So we will have to finish this round with Team B. Team B, are you guys here?
Yeah, we.
Hello.
Team B, Prithvish?
Yes, I'm here.
Okay, great. Giri, we are good to go with Team B.
Okay, both your mics are working. Just test it once.
Yeah, sure. It's working.
Okay, fantastic. So I think we are done with 5 menus, and we are left with the last menu, which is the Thick Shake Factory. And this will be the last question of the DFC Medical Quiz Finals, Social Quiztancing 2020. So I hope you guys really enjoyed it. And now we are just going into the last question. So last question, we are calling it Thick Shake Factory. And Venki, are you ready with the timer? Okay, fantastic. So team B, are you guys ready?
Yes.
Yes, we're ready.
Okay, so I will be starting in 3, 2, 1, and go.
Oh, we're not seeing it. Okay, fine. Strawberry rash is seen in case of hay fever.
33 seconds more. 31 seconds.
Just look at the whole thing and try guessing whatever comes to your mind.
Just see what's in bold.
Yeah, just concentrate on what's in bold. There's
20,
orange, there
20
is grape.
seconds, 19 seconds, 18 seconds. Just see what's in bold. Just 13 seconds.
Yeah.
12, 11, 8, 7, 6, 5, 4, 2, 1. Time's up.
I think team B, they didn't give any further guesses. So I think team B guessed strawberry rash for hay fever. I think that was the one guess which they gave, and I don't think we'll be giving points for that. Anyway, for no points, other teams, do you guys want to try the eponyms? Do you guys?
Pseudo orange.
Strawberry tongue, pewdy orange, grape-like cluster, Staphylococcus aureus,
Grapes for
banana
sarcoids,
sign, Arnold
banana for plasmodium,
Sorry, banana was what? I didn't get that.
plasmodium falciparum,
That
banana sign seen in
crescentic shaped
Arnold Chiari
campesite.
malformation.
Both the answers are right.
Pear-shaped
Then
organ in
pear-
uterus.
The gallbladder is a pear-shaped organ.
Okay.
Uterus is pear-shaped organ. And
strawberry vaginosis.
Yeah, okay.
That is one possibility.
Strawberry tongue Kawasaki.
Strawberry angioma.
Yeah, strawberry nevus hemangioma. Yeah, right. Any more guesses for? Sorry.
Only mango.
dermatitis toxicodendron species.
Yeah, mango dermatitis is toxicodendron species. I think one person got it right. Any more guesses for grape? Grape. One of the guesses was Staphylococcus.
Sarcoids.
Grape
Sorry?
and banana tinea versicolor.
Sarcoma botryoides, sorry.
Yeah, it's correct.
Yeah, correct. Yeah.
Grape and banana tinea versicolor KH mount. It's an alternative for meat and spaghetti.
Okay, fine. That is the one reason why we have this round, is that there is a lot of eponyms which are there, and we collected as much as possible, and that's how we put this round together. And then one great thing is that all the contestants share in what they have learned, and it's great. And then all of us get to learn, so that's something really great. And I think
strawberry gums in vaginous granulomatosis.
I'm sorry, what's mango?
It's the dermatitis caused by toxicodendron. Giri, should go to the answers.
Yeah, going to the answers. Yeah, any guesses for the bonus?
Watermelon stomach. Give watermelon stomach.
Yeah. Perfect. I think almost like all the contestants together answered the whole thing. As such, strawberry, as you guys said, lot of possible eponyms. Banana was Plasmodium falciparum was what you given, and we got I guess banana sign also is right. Podiron's appearance. Breast carcinoma. Grape, one of the other things is a high deform mole. you can associate with grapes. And then the Giardia lamblia trophocytes are also pear shaped. So that was one of the answers. And mango blast, dermatitis by toxicodendron. Toxicodendron is the right answer. And watermelon stomach, gastric antral-vascular ectasia will give you the points. And that brings us to the end of the quiz. And I think in this round, I think team B unfortunately could not get any points. It's fine, completely fine, but we had a great time trying to guess. All the contestants had a great time trying to guess the eponyms. So now we shall look at the final scores. As we already spoke, very, very tight contest at the top for team 1 and team 2. Team E scraping through with 175 points. And team F, they did put on a really good show on the last round. They managed to get 5 answers right. And then they managed to get the bonus answer also right for 35 points a round. But unfortunately, wasn't enough for them to get the first place. So they will be finishing second in this quiz with 170 points. And okay, I can see that even team A, B, and C, the scores have been pretty close actually. But then team B already had a lead from their previous round, and as a result of which they will be getting the third place in this quiz for with 85 points. Team C not far behind, 15 points behind with 70 points, will be getting the fourth place, and team A on 60 points and team D on 22.5 points. So really great quizzing, guys. Really enjoyed it, especially the last round. I think it was really close for the first place. So I think, team E are the winners for this quiz. The first edition of the DFC medical quiz, they will be the winners, and team F come second with
narrow miss.
Sorry?
It was a very narrow miss.
Yeah, I think if team F had got, I think I think only 40 points were possible in the final round. So probably if they got another 5 points, then we would have been in for a tiebreaker, and we would have given some extra questions for the same. But then this is how we will finish the quiz today. So I think so just announcing the prizes once. I think Garima will be taking care of that. So we'll announce the winners officially. And so just one last thing from my side. Thank you so much. Thank you guys so much for participating in this final. We hope you guys really enjoyed the questions and really enjoyed on how the entire quiz was conducted, and we had some really good answers. We had some really good quizzing happening, and I think we are so behind schedule. I told Garima that okay, we'll be done in 3 hours or 3.5 hours, but I think it's 11:15, and I think some of you guys are feeling sleepy, so we are so sorry for running behind schedule and keeping you guys over here. But I think all of us, I'm sure, I think Venki and I both as quizmasters really enjoyed hosting this quiz. We enjoyed making this quiz, and then we really enjoyed hosting this quiz. Usually we would like to host it on ground, with a live audience and everything, but due to the current scenario, we can't really do that, and this is how we'll have to conduct it on Zoom. But then so a huge thank you to everyone again, DFC, who made this possible, the entire organizing team, and then TGT sir, and then from my side, Neha, Pounds Neha, you might have, she was the one taking care of the answers, and the entire team from DFC side, Garima, Yachna, Devashish, and then Devamsh, Dhruv, Yash, I think Roshmi and Namrata, they put in a phenomenal effort, and they just made sure that this quiz really so why they are one of the main reasons as to why this quiz has become such a good event today. So I would be finishing on that note. Again, thank you so much for joining us, and people on the YouTube stream, I'm so sorry I couldn't interact with you guys live because we had the constraints of accommodating our participants on the Zoom call, and we couldn't accommodate you all on the Zoom call. So that's exactly why we had a YouTube stream. I would have loved to interact with you as an audience, but then I couldn't do that. But I'm sure you guys kept your answers coming in the YouTube chat box, and they have been noted by our organizers, and you will be given due mentions. Again, thank you so much for tuning into this live stream. I hope you guys really enjoyed it. I really enjoyed it. I'm sure Venki also enjoyed it, and I'm sure all the contestants also had a really great day. So thank you guys. Thank you so much. So over to you, Garima.
Thank you so much, everyone. What an amazing session that was. Like, really informative, really amazing. We enjoyed a lot. I enjoyed thoroughly a lot. And I hope you all enjoyed quizzing with us too. Congratulations to our winners. Hearty congratulations. Everyone gave their best shot. Like, it was amazing. And so the Team E were the winners. The first runner-up is Team F, second runner-up is Team B, and third runner-up is Team C. So announcing the prize for the winners. So the winners will be getting rupees 3,000 and a subscription of 3 months of eGurukul. The first runner-up will be getting rupees 2,000 and 1 month subscription of eGurukul. Also, our second and third runner-up will be getting 7 days free trial of eGurukul. Hearty congratulations to everyone who participated and also the ones who were part of our YouTube live. Thank you, everyone. Those who answered there, we'll definitely mention you on our socials. Thank you so much. Thank you, Giri and Venkateshwaran. You guys were amazing, like really amazing. We loved the way you conducted it so smoothly. Thanks to Dr. Tirthankar Guha Thakurta. He is our Chief Advisor of Academics and Education Task Force. His guidance and support was really something to just hats off. Like, thank you so much, sir. Thanks to our sponsors. So, our sponsors are Dr. Bhatia Medical Coaching Institute, PLA Remedies, Athulya Assisted Living, and Kasen Pharma. Thank you so much, everyone, for sponsoring us. Also, I would like to just capture again this moment with you all. Thank you so much.
Can we stop screen sharing for once? Yeah. Guys, we'll be having one more picture. So yeah.
Yeah. Wait a second once. So I want everyone to make a victory sign. Like, thank you so much for making this a success.
Team E, can we have you on screen, please, with your face? Yeah.
What an amazing session. Like, really, thank you so much, everyone, for joining in. It was a wonderful day with wonderful minds. Like, I'm so happy to conduct this. Also, you can just go to our socials and watch our work there. You can like, share, follow. Just let us
Can
know
we
how
ask
do
the
it.
winners to speak for us?
Yeah. Sure.
If
Definitely.
the winners, if you want to come on screen and speak a few words, like how you enjoyed it. Hello.
Yeah,
The
Team E.
Team E, you both want to say something?
Can you please share your experience?
Like, really enjoyed this quiz, and this had the vibes of the general quizzes conducted by Major Chandrakant Nair, as I'm sure all of us are familiar with. So hats off to the organizing team. I really enjoyed it. The superb set of questions, and hope to take part next year as well. Thank you.
Huge compliment from his side. I don't think we can ever get anywhere close to Chandrakant Nair, sir. But yeah, thank you so much. Thank you so much. Yeah.
Thank you, everyone. Yeah,
We just wanted to say we also really enjoyed the quiz. It was really creative and like I think it challenged us and like to think out of the box also. So like all the rounds were like different and it was really amazing. Like amazing effort, you guys. Yeah.
Thank you so much.
Yeah, thank you. Thank you so much. Thank you so much.
Yeah,
Also, our work and everything are on socials, so you can go and check them out there. we are having a sexual and reproductive health month this September, and also the PCOS month. So please just look at it. The things we'll be doing, just tell us how do you like it. And for further queries, our socials are always available. You can DM us directly and we'll make sure that someone gets to you immediately. Also, these sessions will be there on our YouTube, and you can go and watch it whenever you like. Hopefully, we'll be coming up with our next quiz very, very soon. So, thanks to everyone for just making this success, and thank you so much, everyone. This is me, Yachna Kabra, Calcutta Board Direct Project Head, signing off. Thank you so much, everyone. Good night. See ya. Bye bye.